January 5th, 2025. The time is 7 p.m. and we are in the Aldermanic Chamber. It has been duly noticed in 2 places, including the city's website, in accordance with the requirements of RSA 91A. Could the clerk please call the roll?
Yes. Alderman Tim Senate is here. Alderman Thomas Lopez.
Here.
Alderman Ernest Jetty.
Here.
Alderman at Large Ben Clemens, Vice Chair.
Here.
And Alderwoman at Large Shoshana Kelly, Chairwoman.
I'm here.
Also joining us this evening are Mayor Donches, Director Bagley, Director Cummings, Alderman Wilshire, Alderman Klee, Alderman Tebow, Alderman Govea, Alderman Moran, and Alderwoman Timmons. I apologize if I missed anybody. We have a very large complement tonight.
We have almost the entire board here.
Yes, we do.
Okay. So public comment. If anyone from the public would like to discuss anything on our agenda this evening, please come to the podium and state your name and address for the record.
Good evening. My name is Paula Johnson, and I apologize. I don't have a copy of the agenda in front of me. I know the clock is ticking here. It has to do with O-24041, increasing the elderly tax exemption. I brought it to everybody's attention here. I did a spreadsheet, and I did have the chance to meet with Mr. Cummings, Alderman Moran, and I forgot your name. Thank you. Okay, thank you. And they did an analysis and a spreadsheet also. But you know, I don't know if all of you are out there talking to the public like I am. I work with the public. I'm out there all the time. I had a welcoming committee when I came here tonight, so I guess people don't forget my face or probably my voice. But I'm going to tell you something. Us seniors, we're not elderly, we are seniors. Elderly is what my parents were. We are not happy with what's going on in this city. It is costing us an arm and a leg to be able to afford to live here. Maybe the goal is to get rid of all us seniors, but it's the seniors that's the backbone of this city. We have had our homes for 30+ years, and we've paid for everything. I have served on the Board of Ed twice and on this board. And you know what? The amount that we are paying is outrageous. We have a declining population in the school, and the costs keep rising, and it keeps costing us more money. You want more and more projects done, which, where is the priority? I mean, I'm looking at the projects that are going to come before you tomorrow. I'm like astounded, especially the rail. But you know what? We cannot afford this. People who have been in retirement are coming out of retirement. People who want to retire can't retire. Because you know what? Our pensions, our Social Security does not cover the amount that we're paying in taxes. The only thing that saved my husband and myself this round was because we have that $750 veterans tax credit. That saved us from over a $900 increase on our property taxes. That's unheard of for senior citizens. 40 years plus in homes, we've paid for kids before our kids went to school, our kids going through school, kids now going through school. Is that a selfish thing? I don't think so. Is it selfish that we're asking for to be considered? We are not being considered here.
Seconds.
Our citizens, it took how long for me to fight to get that veteran tax credit because somebody has to pay for it? That's right. Us veterans and spouses of veterans have paid for more than we should pay, and we're now being forced to pay all these high taxes. I hope you're going to start considering us because you know November's around the corner here, and being who I am with a big mouth here, and I can get out there and broadcast very nicely, I will start broadcasting all of you who don't consider us anymore, and there's a lot of us seniors out here, and we're fed up. Thank you. And you know what, the rule of 3 minutes, I looked at your your codes here. It was originally 5 minutes here. 3 minutes, considering we are the ones who pay. We're the taxpayers, and we vote all you people in. 3 minutes is not enough. And why don't you be a little bit more considerate, because everybody around this horse should go on forever.
Would anyone else from the public like to speak? Okay. Communications.
Communication has been received from Lisa Photo, Director of Public Works, in regard to referrals from Board of Aldermen 024043.
Being no objection, I will accept the communication and place it on file. Sorry, thank you. Interviews.
All right. Up first for the Zoning Board of Adjustment, we have Joshua J. Nahili, reappointment for a term to expire September 11th, 2027, 10 Roderick Circle, Nashua, New Hampshire, 03062.
Mr. Mayor, would you like to introduce Mr. Nahili, please?
Yes, Madam Chair. I am here because I've nominated Josh Nahili for a reappointment to the Zoning Board of Adjustment. You can see from his resume that he's had a variety of business experience and has lived in Nashua for some time. Mr. Nahili has served on the board now for a couple of years, and this is a board that is difficult in terms of the time commitment. I know that Mr. Nahili always reviews all of the materials. It's usually a long meeting on a Tuesday night, or is often a long meeting, considering 4 or 5 cases at once, or on one night, usually often with contention on both sides. Now, I know that there is a decision concerning the archery lane that some of you disagreed with, and therefore, and have expressed that point of view. I'd like to address that briefly in saying that the ZBA is always going to make decisions which some people disagree with. I've often disagreed with ZBA decisions, but the job is not an easy job, and the important thing is that the person is dedicated, uses their own judgment in terms of trying to decide whether a variance, a special exception, or an appeal are justified. And I know from talking to the staff that Mr. Nahili is highly regarded in terms of his energy and his commitment to the mission of the ZBA. And therefore, I don't believe that whether I disagree with a decision that Mr. Nahili and the others have made or not, which certainly I have, I don't believe that the disagreement with a single decision is a legitimate reason to vote against someone who's willing to serve the community further by continuing on the ZBA or any other board, really. So with that, I will turn it over to Mr. Nahili and ask him to say a few words about his service on the ZBA or his involvement in the community and of his interest in this continuing on this board.
Well, thank you, Mr. Mayor, and Madam Chair, members of the Aldermanic Committee. It's been my great honor to serve for the last 2 years on this board, the first year as an alternate, the second year as a full member. It is amazing how dynamic our community is. I've had the chance now to get into many neighborhoods I never would have had the chance to get into when you kind of pull back the curtains a little bit, and it is fascinating. The people that we have in this community. When you think about what we do, the majority of folks who come before the board are homeowners. They are, kind of terrified to be coming before a board and have to step up there and present their case. And I like to think that we humanize the board when the folks come up there. I take great pride in talking to these folks and expressing that I'm also a volunteer. I'm a homeowner as well, and just tell us what you're trying to do in your words. And it is amazing how you can kind of take the air out of the balloon a little bit and make folks feel a lot more comfortable. I do believe the members of the board, for the most part, are a can-do group. When I was thinking back, getting ready for this meeting here tonight about where we go and where we don't, we approve about 90%, in my estimation, of the applications that come through, because they really are the right thing to do. It is amazing the projects that we have been able to work with and to approve. And if you were to move me along for another 2 years, I would be honored to continue to serve because we really do have such a dynamic community. I do think there's some exciting projects coming, and I do think we still have a ways to move the city forward. We all know that we're in a housing crisis, and we're doing everything we can to kind of move this through. We just heard a few minutes ago about the taxes that have gone up, And so many of the folks that come for our board, they're trying to get the ADUs so they can let their families live there and afford something. We hear that more and more. I just want my family to live here. We can't afford blah, blah, blah. I will tell you, we have not denied any ADUs in the last, my 2 years on the board. I think that's very important to increase the housing stock here in Nashua. And we're really proud of what we've done. But I'd be happy to answer any questions from anybody. And not just here, but if you do move me forward, I'm always an open book. I am often at Bonhoeffer, so if you want to share a coffee with me and discuss what's really going on, we'd really be happy to do that.
Okay, we have a large group of aldermen here this evening, so I'm going to take questions from the committee first, and then I will make a list for anyone else who's got their hand up. Alderman Lopez.
So as a point of personal privilege, I wouldn't characterize any concerns I had about your appointment as disagreeing with the decision. I do in that case, but that's not something that I would use to prohibit another appointee from anybody, especially one that's experienced. What I would be concerned about is not declining, is if a body declined to meet with legal counsel and then later made a decision that we had already settled. That would be my concern. So in your words, can you describe that situation as you understand it?
Mr. Nahili?
Yeah, I was actually a little surprised when I was brought up to speed on this discussion recently. In my 2 years on the board, we have never met with legal counsel in person. And until about 6 months ago, the first contact that we had was an email from the legal counsel with his opinion, and I assume you're probably talking about the Archery Lane, but it was his opinion on Archery Lane. Unfortunately, we were not able to do an in-person. The schedules of the folks on the ZBA, nobody seemed to match up, and it didn't match up with legal counsel. So we were not able to do an in-person. It was a very small window of when he offered that information versus when he met with us. And I will tell you, there has been no other attempt to contact legal counsel during my 2 years on the board. The only other time that I've heard legal counsel referred to is Carter Falk let us know, who is our liaison, that legal counsel had let him know in regards to the Granite Street, when it came back to us, that we should run it as a full hearing again. But that is the extent of any communication with the legal counsel.
Alderman Lopez, follow up.
Just as a follow-up, were you aware of the court decision regarding that or the settlement that was publicized?
So you're talking about the local, the Circuit Court of Appeal opinion that the council was talking about, or any type of payout here in the city of Nashua?
Specifically, the settlement that we made when the organization that was trying to push the zoning board appeal forward had to settle with the city, and the city didn't necessarily want to get into a legal battle over whether we would, what constitutes a disability or what is a violation of the ADA.
We would just, excuse me, I was just made aware of that recently during conversation, but I certainly have not seen that in the newspaper and was not made aware of that before.
Interesting.
Alderman Lopez,
I'm surprised by that, I guess, because I thought that was publicly known, and, you know, having it come back to the board, the zoning board, as it did, it seemed like that would have been brought up somewhere.
At no point was any talk about any final monetary payout made to us. I still don't know what the payout was and if that's occurred.
Okay, it's
I'm
public
running off
record
of-
and in the
yeah,
newspaper, so.
I'm running off of a rumor, so no, that is definitely not made public to me in any way.
Okay.
Alderman Lopez, do you have any additional questions?
I accept the statement as made.
Alderman Jettie.
Thank you. So, thank you very much for your willingness to serve on the zoning board. I know that it's not an easy job, and and I know that I've been involved in some cases that before the zoning board where you have been a panel member, and I thought you handled yourself very well. But something that has concerned me about something that's, I don't remember your ever saying this during one of the meetings, but I know that some of your fellow panel members have said, and something that you said tonight kind of hints at that and bothers me a little bit, and that's your statement that you're a can-do board, that you're here to help people, and I understand, that, we're all here to help the citizens, but I want to make sure that you appreciate and accept the fact that the zoning laws are adopted by the Board of Aldermen. And when the Board of Aldermen adopt the zoning law, that's the law. And when people come before your board to get either a variance from that law or a special exception, if it's permitted by the law, there are certain criteria that have to be met, designated by state statute and in our own ordinances. And it bothers me when I hear somebody say, that, and I'm not saying that you've said this, but some of your fellow members have said something to the effect that, yeah, I don't think that law is good anymore, or I don't think that law should say what it does. I think we ought to change that. And they take on the role, in my opinion, wrongly, of substituting their judgment for the Board of Aldermen. If the criteria for granting a variance are there and are met, then the law enables you to make that decision. Or if the conditions for a special exception are met, the law allows you to grant the special exception. But if they're not met, it is not the job of the zoning board of adjustment to make exceptions to the law, or to change the law, and to say, well, we don't think the law should be this. Times have changed. The law ought to be changed. It's not your job to change it. It's our job. And if it needs to be changed, then your board, through the planning department or directly, you can make a motion and recommend to the Board of Aldermen that something be changed. But it's up to the Board of Aldermen to change it, not the zoning board, not the planning board. So, can you guarantee me that you will continue to apply the law as is written and make your judgments according to the law, and not try to substitute your judgment for mine or my fellow members of the Board of Aldermen?
Yeah, Alderman Jettie, I completely agree with your statement. And I'm actually disheartened to hear that you think that folks may be trying to work around the Board of Aldermen. That is not my opinion. The Board of Aldermen sets the regulations. It's our job to look at those special criteria. So I'm certainly not an activist, and I'm not aware of any activists on the board who are actively trying to circumvent anything. So I am sorry to hear that maybe that thought process, but that is definitely not my intent in any way. I think if that's the case, it may be just some folks who are frustrated to hear a same type of case every once in a while. But at the end of the day, everybody knows that the Board of Aldermen are the ones who are going to come up with these regulations. It is not our job to circumvent in any way.
Thank you.
All set, Alderman Jettie?
Yes, thank you.
Other questions or comments from the board? Alderman Moran?
Thank you. I'm not on this committee, but I won't be voting for you when you come to the full board, because you did vote against disabled people in the city. But if you could recap, you received an email from Corporation Counsel that of their opinion before you took a vote. Was that correct?
That's correct.
And what was their opinion? Was it the way you voted or the opposite?
The opinion of council was that we should vote against the folks in the neighborhood who had brought this forward. So in favor of the owner of Archery House, the new owner.
And you didn't follow that advice from the,
That's correct.
okay. How did it feel voting against disabled people?
So I do have a level of distaste with the way that you just put that. I don't vote against disabled people.
Bet you did.
I did not. And maybe I think what I need to do is kind of present from a 30,000-foot level exactly what we saw. As a reminder, or maybe you weren't aware, and I know you have a ton of things going on, maybe you don't see some of the things that are going on, but we did have multiple aldermen that also came out against that project as well, via writing. We had counsel for the butter on archery, who presented a very, very good case. We did have the written statement from the local council, the city council. And then we did have via Zoom another lawyer who was based out of Providence, speaking for the property owner. Archery was the hardest case that I have been involved with in 2 years. I like to equate it to the fact that that was the ZBA's derivative to the asphalt case. As you know, in the asphalt case for the planning board, people had quite a few opinions. There was signage all over town. Same thing when it came to archery. If you went to that neighborhood, every house had a sign in the yard around that block there. It was the fullest I've seen that room with folks in there, including children who came up to do some testimony. It was a very difficult case. At the end of the day, we took a look at the applicant, the original applicant, and if you remember, the applicant did not apply for anything. They just started construction on that work, and they were called up by their neighbor who was kind of poking around and said, "Hey, hold on," informed the city, came to us. The way the presentation went down, the lawyer from Providence, who was representing the owner, in our opinion, was not straight with us on what they were trying to do. Could not tell us how many folks were going to go in there. Wouldn't provide us any information. Wouldn't even stipulate to the fact that it was going to be a house where folks were going to be going through any type of alcohol rehab, which is what it was for. Eventually, they came out from somebody else who made the presentation to us. And we had just about 2 months before come out of another case with a alcohol rehab on Kinsley Street. And the way they presented to us, they got it right through. We were able to work with the neighbors because there was some neighbors who were in opposition to it. And we really thought that was the way to go. They were very upfront with everything versus the archery, who we did not feel was upfront. But at the end of the day, when you look at the vote, what we asked for was that we thought this needed to go through the full planning board process, and they were trying to avoid the planning board. We thought it needed to have more light shined on it to really see what was going on. This was a for-profit organization that wasn't giving us straight answers. This in no way was about voting against handicapped people. Really, the reason that I take umbrage with that is I do have a special needs brother, so you really just hit a chord there when you talk about that type of thing. It was difficult. That kept me awake at night thinking about this and going up to it. There was some very impassioned people there from the neighborhood, and it was a tough decision. Hopefully, we don't have any more like that in the coming term if I get so moved along. But it was very, very difficult to deal with. There were winners and losers on both sides. I like to find a win-win for everybody, but in that case, the two sides were just too far apart to try to find any type of common ground in the middle.
Follow-up?
If it is kind.
Sober homes are not rehabs. They're places where people go who are in recovery, and they receive no treatment whatsoever at a sober home. It's just folks who happen to be abstaining from alcohol and drug use. That's how a sober home is defined. So it's just, why should anyone coming to create a home talk about who's going to live there? Yes, there's concerns because it came to PEDC about not getting permits for refurbishing the home, which is a separate issue. But knowing who's there and for what it's no one's business because it's private.
So thank you for saying that. Unfortunately for that group, one of the folks did make a statement that there was treatment going on in the house, or they did plan to have treatment going on in the house. And according to the RSAs of the city, that made it a halfway house, and we had to look at it as a halfway house. We had that discussion.
It's interesting, that's not what was relayed.
I
Director
would,
Sullivan.
so there is a very long YouTube, if you'd like to watch it, but it is there to be seen. And one of the folks who did make a statement via Zoom is really what kicked us over the edge, that there was going to be treatment going on in that house.
That there was going to be medical treatment happening.
She said there was going to be treatment in the home.
Did you ask what it was, what it would be?
I don't think we're going to dig into what kind of treatment people are going to do. I think that's a little beyond what we're trying to
Because-
work on.
To my understanding, to just have one person say it off the cuff, and then have a legal opinion that we shouldn't be getting in the way of the ADA, the Fair Housing Act, but yet all 5 of you decided to take the opposite opinion.
And we did, because we did feel that what the opposing counsel provided to us was more compelling. And we were specifically looking at the definition of halfway house after this person on Zoom made the statement that there was going to be treatment in the house.
But you took the vote instead of following up on what the question would have been.
Yeah.
Thank you.
There would be no reason for us to table at that point. That's just,
Thank you.
Other comments? Alderman Clemmons.
Yeah, can I ask a follow-up? Who was the person on Zoom who stated that? Do you know?
yeah, it was and I couldn't tell you her name, but she is a woman who deals with sober homes in New Hampshire. She was from a third party somewhere in the state of New Hampshire, not specifically that she was on there to support the group, and said she had worked with them in the past, but I can't tell you off the top of my head what her name was.
But this person was not representing that group in the sense that, like, one of the attorneys brought her forward and said, this person is representing this group. That was a public comment.
Correct. She was from one of the groups based in New Hampshire.
So I guess I have a concern with that. My concern with that is that the public comes to us, and we listen to the public, and we listen to what they have to say, and we take what they have to say seriously. But you also have to listen to what they say, and you can't always take what any member of the public, for example, says as gospel. You have to do research, you have to understand what it is that they're coming to you with, and make a decision based upon facts. And so that answer that you gave is concerning to me, because any member of the public could go up to any board and state something that isn't necessarily true. And if the board members take that as gospel, they're gonna make bad decisions. And so whether or not that happened in that case, what you're saying to me is concerning. So, I respect what I personally do not believe that you intentionally voted against handicap folks. I don't think that's what happened. I think you were in a tough position. I think there was a lot of pressure from that neighborhood. I think there was some pressure from other aldermen. But, in the end, an opinion was put out there from our corporation council warning us that this was going to be a violation of the housing rules, of discrimination laws. And ultimately, the city ended up settling a lawsuit because of that. So it's just, I understand that, we have to give grace and understand where. Here's my question to you. Do you think it was a mistake? Do you think that vote was a mistake, knowing what you know now?
Alderman, as I stated earlier, I think that this was the most difficult case that we have dealt with. Nothing has come close to it. When you start dealing with Fair Housing Act, we're all volunteers. That's not our cup of tea. We probably would have to look at it a little bit different now. Yeah, hindsight's 20/20, right? So if corporate counsel came to us now and said, hey, man, I got a real problem with this, let's take a look at it, we probably would table it, would make sense, and just kind of let things cool down a little bit, let's take a look at it again, because we were just getting conflicting from everybody. Once again, we just trying to get things through, right? So it's not fair to them to keep dragging it out as well. These, and not just that group, but everybody in the neighborhood, everybody's coming out every time. It's definitely a live and learn situation on this one. I'll give you that. Hopefully we won't get into it again, but it was, we would probably table it and dig deeper. I couldn't tell you much about the Fair Housing Act. I can give you a 30,000-foot view of what it is, but.
Yep, so if I could, just one follow-up. So am I correct in hearing you say that in going forward, that when Corporation Counsel reaches out or Corporation Counsel is at the meeting, that you're going to listen to what they have to say and take that under advisement?
Yeah, and quite frankly, as a taxpayer, I don't want to cost the city any money.
Right.
My taxes are high enough. I'm done with the extra
Right.
money, so it doesn't make any sense. And it's also what it comes down to what I said earlier. I don't think anybody's an activist. Nobody's trying to prove a point, to my knowledge. So that being said, yeah, I think if we went through this again, hopefully we don't. I think we could lean on corporate counsel more, and maybe we need to reach out to them. I mean, we've never reached out as a, hey, we need help in my term. I understand it may have happened in the past, but yeah, it's just kind of been out of sight, out of mind.
Okay, thank you for that answer.
There is a different understandings regarding the lack of a meeting with Corporation Counsel. I mean, Corporation Counsel's office, their perception is that they wanted to meet, but the board wouldn't meet with them. The staff in community development thinks that, putting 5 ZBA members together at a particular time, they just couldn't do it, that they could not arrange a meeting during the very limited opportunities that the legal office had, available. So it wasn't, in their view, it wasn't that the board was refusing, it was that they just, they couldn't get the schedules together.
Well, hopefully both parties can work on that in the future, but.
I'll say, thank you for answering these questions. I think that we've done a good job of covering this. I don't want to re-examine or relitigate this. The answer you just gave was what I was looking for. I know that we started out by saying we're going to vote against someone or for someone, and for me, it was more about what happened with legal, and if they reach out in the future, would you be willing to listen and find the time or table to have the time? And you just said you would. So that was the biggest concern that I had. Alderman Clay, go ahead.
Thank you, Madam President. Was going to say exactly what you said. No, I'm glad you said that. But I want to add that what you just said, and I thank Alderman Clemens for teasing that out of you. And prior to that, I made comment to something that was happening in my ward and with community development and so on, and in a situation that was happening with a couple of homes that kind of, whether or not it was going to go through planning and so on, something very similar and so on. And there was back and forth. Does it go to planning? Doesn't it go to planning? And there was a lot of conversation, a lot of discussion. No, it doesn't have to. The state was involved and so on. So there was a lot of mixed messages of what happens or what doesn't happen. So there was a lot of gray areas. I'm glad to hear exactly what you just said to Alderman Clemens and to the board here, that you would seek counseling. You would actually perhaps ask them. That is extremely important because a lot of times there's mixed messages. It's very confusing. Laws change. I think Alderman Clemens pointed out that sometimes the public says something not to be necessarily contrary or to give false information, but it's because something that they believe to be true, and so on. They're not necessarily doing it to be bad, but it's something they believe to be true. So you have to do your own homework. As you know, you've been on that board long enough, so you have to dig in, and we take everything with a grain of salt, and we have to do our own thing. I think you've answered questions. I don't get to take a vote here tonight. These members will do it, so I think you've worked really hard. It's a difficult job. I'm the liaison to the planning board, so I know that difficult, wearing that kind of a hat and so on. But I know these particular situations are very, very difficult, and I know how hard it is to deal with residents that living in that area. So thank you for your willingness, and you answered the question properly. And I thank my colleagues for teasing that answer out of you, and you doing the right thing, stepping up. And I hope your colleagues will do the same. So thank you.
Anyone else from the board? Oh, Alderman Senate and then Alderman Lopez.
Yeah, not to belabor that point, but just to sort of drive it home, I guess, is, to the best of my knowledge, there's 2 lawyers in the room right now. But most of us on the Board of Aldermen aren't lawyers. And while we usually spend our time knee-deep in the NROs and the RSAs, and we usually need guidance in understanding them so that we can draft legislation, put it forward, and hopefully get it across the finish line without overstepping our bounds. What I'd expect of planning board, zoning board, especially where, as you articulated, these are volunteer boards, especially in a quasi-judicial capacity, as Alderman Jetty likes to often point out here, is that you do the same. I think Corporation Counsel is an outstanding resource for anybody making decisions in this city. And I'm willing to give you the benefit of the doubt that you will seek their guidance in the future and you will heed their guidance in the future. But I can't emphasize it enough for anybody with interest in these boards who may be listening that we have them there for a reason, and we definitely need to heed that guidance. So thank you for your answers tonight. Thank you for your willingness to sit in the hot seat.
Alderman Lopez.
This previous speaker said much of what I just wanted to impart as well, that the legal department is a resource and a necessary protection for volunteers in the city of Nashua, but they also are trying to protect the city's assets and the taxpayers. And we've heard how much we don't want to be spending more money than necessary. It's really important that we recognize major federal legislation and some of those risks that we might walk into when we're making that decision. And, legal is our best defense against that. The first defense they can offer is, don't do that. That's gonna go bad. They've offered it to me a couple of times, and I've understood the message. So I guess if you don't have them sitting across from you in a room, they might seem like a distant entity, but they're very relevant. And I would definitely recommend, any volunteer not only seeking their guidance when necessary, but asking them to present on specific things like the Fair Housing Act, so that you have that information. We do that like at Human Affairs Committee. We have different city entities present so that we know what we're talking about. And it still doesn't hit the mark because we're never going to reach the level of expertise that some of our staff members have, but at least we can use them as a resource and we can point to their presentations to educate others. And to that end, having had the Community Development Department at Human Affairs more than a few times, I don't see a future in Nashua that won't encounter this situation in the future, because New Hampshire is a state that arguably a good percentage of our revenue is based on encouraging people to drink, or at least monetizing the fact that they will. So you can imagine there's going to be a predictable amount of people that experience substance use, experience misuse, experience chemical and behavioral addiction, and end up meeting the criteria that the ADA covers and need the supports and the resources to move out of that situation. And I think sober housing is complicated. I think we've been grappling with it at the Human Affairs Committee, how to provide the best advocacy for the people who are in it, how to manage it as a city responsibly. It's a very complicated question. I'm just impressed that it hasn't run into the zoning board before. So I would definitely follow up on that, and if you're interested, we'll have presentations that might be relevant to this at the next Human Affairs Committee. because we do regularly try to keep up to date on what community departments are doing, what they're doing for inspections, regulations, and all that kind of stuff.
Okay, all set. I would like to thank you for coming forward, for your willingness to volunteer. You've been calm and clear and concise and thorough in your responses. So thank you so very much. We'll be taking up your nomination a little bit later in the meeting.
Thank you, Madam Chair, and everybody on the board. I do appreciate comments. I know there was a lot of discussion back and forth, but I do appreciate the back and forth.
Thank you.
Okay.
So here's the big one. So next,
I'll just say something quickly. So tonight we'll be interviewing 3 candidates for Board of Health. This is unprecedented. We haven't had this before, so we'll be talking to 3 candidates. We'll do them individually in the order that we have on our agenda. So we're going to start off with,
all right, so our first candidate is Henry J. Osh, 77 Northeastern Boulevard, Nashua, New Hampshire, 03062. Oh, and I should emphasize, this is for a term to expire December 31st, 2025.
if you could join us, and Director Bagley, if you'd like to introduce Henry, I know you brought him forward. You guys can sit in either of the chairs. Sorry, there's none together. We have a crowded room tonight.
Good evening, and thank you. Bobby Bagley, Director for the Division of Public Health and Community Services. And I and my team, our strategic leadership team, have made a nomination for Henry Och to be a member on the Board of Health, replacing the community member that we previously had, Dr. Storis. And I just wanted to give a little bit of background. Many of you have seen Henry's resume, and what we're looking for is, in looking at his resume, he's demonstrated that he has the ability to serve in this role as a member on the Board of Health. He has 20-plus years' experience in working in healthcare administration and in leadership, has some history as a U.S. Army veteran, commissioned infantry officer with the current rank of lieutenant colonel in the Massachusetts Army of National Guard, has also served in the role as leader and collaborator on expanding services and ways to ensure our New Hampshire populations, including communities from diverse backgrounds, have equitable access to high quality and culturally proficient care. Henry also, as the president and CEO of Harbor Care, has a number of years' experience working with some of the vulnerable populations that we serve as well over at the Division of Public Health and Community Services, has worked with our Division of Public Health and Community Services as a partner in addressing some of the issues that require a response for this particular population. He provides over at Harbor Care an integrated approach, which is also something that demonstrates the experience and the qualities that we would need in a member of the Board of Health. And currently, right now, is in a doctoral program where he's going to be getting his leadership degree in psychology, and also has served as a number of years in the community at Harbor Care before becoming the CEO and the chair. And so we've put forth this nomination for the position for the Board of Health, for the community position.
Thank you very much, Director Bagley. I have a series of questions that I'm going to have everybody answer, but I'll open it up to the board after Henry introduces himself. And if they're answered, I'll just take them off, but I'll ask those at the end.
Thank you very much, Director Bagley. Thank you to the board for having me here today. I am very honored to be given the opportunity to serve this great community that I've seen firsthand respond in such a deliberate fashion during the COVID-19 pandemic. It was really something quite remarkable. I joined the organization Harbor Care in February of 2020, so I really saw the community come together in a way that I really had not seen in the past in other places where I have been employed. And at the root of that was community partnership. I saw that come through loud and clear from city government to the nonprofits to the healthcare organizations across the city. Now, when we're talking about public health, it's a multifaceted, multi-dimensional concept which involves infrastructure, systems, and at the end of the day, people and behavior. So when we're looking at a public health matter, we really have to look at the issue through those many lenses. And then what further complicates the issue is an individual's socioeconomic status, and of course, any potential racial or ethnic disparities that might be at play, which impact the overall health of the community. Director Bagley went through my background. I'm happy to answer any questions that you may have about that. And again, thank you very much for having me here tonight.
All right. Questions from the board? Alderman Jettie.
Thank you. So thank you very much for being willing to serve in this capacity. We've met, and I was very impressed with you when I met you, but I met you as the CEO of Harbor Care, and I think you're well qualified, and I think that I think you can serve in this capacity very well. My only concern, and I'd be interested in knowing your answer, and Director Bagley as well, and it just occurred to me, Harbor Care is very much involved in the work that the Public Health Department is involved in, and I'm just wondering, is there any conflict there? Is there any reason why you shouldn't be on the Board of Health because of the fact that you're the CEO of Harbor Care?
Well, the board and the subcommittee certainly have control measures in place in the event that there's a matter that goes before the committee, which Harbor Care has an interest in. In that particular case, I'm more than happy to abstain from that discussion or offer insights from that particular perspective. But the fact that the matter is that the way that I look at this particular assignment is in the best interest of the community, not necessarily the organization for which I'm employed.
Director Bagley, would you like to add anything to that?
Yes, thank you, Alderman Jettie. The Board of Health serves as advisory to our Division of Public Health and Community Services. And for the most part, the role that the board plays is in hearing the reports from some of the work that we're doing, and then providing guidance and support for policy that would, again, impact the public's health. And so it's not necessarily related directly to an organization. One of our other board members works at Dartmouth-Hitchcock and has been on the board for a number of years. So that's another organization that we have the same type of partner relationship with that we do with Harbor Care and any of the other organizations that are in the community. One of our previous board members also worked at Southern New Hampshire Health Systems. Again, we have partnerships with a number of organizations in the community. And the way that the board works with us is really in an advisory capacity, and that they don't represent their organizations when they're on the board.
Okay, thank you.
All set, Alderman Jettie?
Yes, I am. Thank
Other
you.
questions? Alderman Lopez.
It does feel a little bit uncomfortable having the Public Health Department endorse somebody who's going to be on the one of the commission for public health. So I kind of see an analogy being like if the superintendent of the schools endorsed the president of the school board, that'd be a little bit awkward. But I would imagine that the candidate was identified and vetted because of all the work that he's done in the city of Nashua. So I've worked with you, Henry, and Harbor Homes. I would consider them to be probably one of the, if not the biggest, at least one of the top three biggest low-income housing voucher providers, one of the most effective organizations in intervening with people who are either at risk of homelessness or coming out of it. Their leadership on the continuum of care is undeniable. And so to that point, I would have similar questions about how would you navigate, like, if the welfare assistance program was announcing that, giving data that there were a lot less people, for example, who were applying for benefits one month versus the other, and you were conscious of the fact that, okay, well, but we haven't had a shortage of people, something might be going on. That's information that you can bring forward that speaks to the qualification that you have for oversight, but it's also information that might be interpreted by the public health department or welfare department as, okay, well, we need to make sure we're taking care of harbor care patients, because otherwise it'll come up that, you know, they have a difference of opinion on that. How are you going to navigate any perception? And I don't think abstaining alone at the moment is going to be easy enough, because there's only 3 members of the Board of Health. We all know there's like a referendum item going forward that may or may not be adopted by the people of Nashua, but that's not going to happen until minimum next November. So how do you navigate the perception that your word and the knowledge that the information that comes from is representing something bigger?
Well, I think the answer lies in facts and actions. Ultimately, sound decisions are based off of facts, critical thinking, and presenting an argument that ultimately is in the best interest of the community, and the actions that follow that will ultimately tell the story. So, can't necessarily control the perceptions of many, but you can set the conditions to ensure that the facts are processed accordingly.
Well, that question aside, I want to be clear that your resume is impressive. I can see that you're very involved in the community of Lowell, particularly with, you know, volunteer efforts. The work you're doing at Harbor Care is impactful enough to the city of Nashua. Nobody could have asked you to do more, and yet you're willing to step forward. So I appreciate you being willing to be considered. I want to try to be fair to all 3 candidates. But I appreciate that you are putting yourself forward in addition to all the other things that you're doing.
Thank you.
Alderman Clemmons?
Thank you. So I'm going to ask a question that's been on some people's minds lately, and it gets down to something else, ultimately. But the question would be, do you think it's the place of the Board of Health to opine on something like Anthem deciding not to cover people at St. Joe's? Or do you think that's outside the scope of the Board of Health?
So when we're looking at the concept of public health in general, I want to go back to an answer that I gave previously, and that is when we're talking about looking at problems and solutions, there has to be at the systems level. So we need to determine whether or not the issue with St. Joseph's has impacted the broader environment. If it's impacting the lives of many of the residents within Greater Nashua, then we at the very least should have a discussion about it, because at the end of the day, that is our charge, to be mindful of the overall well-being of the public health of the population.
All set, Alderman Clemmons?
Just to follow up on that, so would you be so bold as to make a, would you, after having that discussion as a member of that board, be willing to put forth an opinion of the board?
Well, if at the end, so if we have individuals that, for some reason or another, have a loss of coverage, of insurance coverage for medical treatment, then we need to help identify the resources for those residents to seek the resources that they need to get that care while this is getting resolved.
Okay, thank you.
I don't see other hands up. I have 5 questions in front of me. Okay.
Wait, I'm not on the committee.
Okay, I'll do my questions first. In the interest of keeping all the interviews fair, I have 5 questions in front of me. I'm going to ask you the same 5 questions as everyone else. So question 1, you've started to talk about, but I'll just ask it anyways. Discuss your experience volunteering on boards.
On boards. So I have worked for the Health Management Coordination Coalition, Region 3 within the state of Massachusetts. That is a coalition which coordinated all the emergency response efforts, and we worked with fire, police, EMS, and other agencies to put together community response plans. I sit on several nonprofit boards ranging from the Boys and Girls Club to a large mental health provider in the Merrimack Valley in Massachusetts to a community development corporation, which I recently resigned from. And I also sit on the bi-state board, which represents federally qualified community health centers for Vermont and New Hampshire.
Great. Thank you. Next question. What do you know about the work that is done at the Division of Public Health and Community Services?
So quite a bit. I've had the privilege of working with the Public Health Department for over 4 years at this point, beginning with COVID response and subsequently working on issues identifying and providing services to the homeless population within Greater Nashua. One of the I think proudest moments for me and the organization that I represent is being able to provide permanent housing to over 200 chronically homeless households within the Greater Nashua area. But that was in collaboration with not only the Public Health Department, but also the Welfare Department and other community partners across the city.
What do you think is the primary health issues impacting public health right now?
Quite a few, beginning with housing. So having stable housing certainly has an impact on not only the overall well-being of an individual, but also their physical well-being. For example, if you walk into an apartment that has, let's say, rugs that are not kept up with, poor ventilation, that can very well be an asthma trigger for young people specifically. So that's housing in general, I think, is a big public health concern. The issue of homelessness, of course, rises to the top of the list, and overall access to services, whether that is primary care or behavioral health and addiction treatment. An area that that I am particularly interested in is what is the farthest upstream intervention that we can identify within the system. And one of the areas that's very important to me is access to behavioral health care, specifically for young people.
You know when the Board of Health meets Wednesdays, 12:30 to 1:30? Not a problem
No.
scheduling-wise? Okay. And then last question. During emergency events, the BOH provides advisory support for the health department. How comfortable do you feel with that role?
Very, very comfortable. As was previously stated, I have served with the United States Army National Guard, now with the reserves, for over 23 years. I've been part of 6 emergency response missions through that, from hurricanes to ice storms, the COVID response, of course. So I'm very comfortable going into the incident command mode and providing support as needed.
Incident command mode, love that. Did you also know that the Board of Health is involved in the inspection of milk per our city charter? Just found that out myself. Okay, that's my questions. I'm going to open it up one more time to board members if there's any follow-ons. Alderman Moran.
Thank you. First off, I will be much kinder to you than the previous person. I am very impressed by your resume and a huge improvement over your predecessor. I got that right. the change that you've led while at Harbor Care, being involved in the community as a community partner, which is very significant. My question would be, you are very qualified. You're on many boards. You're a CEO of a very large company here in the city. Why should we pick you over other providers in the city who maybe don't have a full slate of volunteer boards that they're available for? Why stretch yourself out so thin when there are others willing and able to participate?
So that's a great question, and it's a very fair question, and I will answer it very directly. When something comes on board, something has to fall off. So if I were selected to join this board, I would drop off one of the other ones that I'm a member of almost immediately.
Well, I don't think you remember this, but I used to work for Family Services in the Merrimack Valley a long time ago. And I think we met at one of their functions
Oh, wow.
years ago.
Yeah.
And it took a while for me to trigger memories in my head.
Yeah.
But I hope it's not Family Services.
No, that's a great organization. Actually, that's one of the organizations that deals with some of those upstream issues that I'm very passionate about.
When I was there, I oversaw the therapeutic mentoring program. It was quite a bit ago. And follow-up? Can I have a follow-up? One of the things regarding your potential colleagues on the Board of Health, the Board of Aldermen saw fit to put a ballot measure this year to add a social worker and a nurse. The previous chairman and the current two doctors were opposed to that. And I know you're soon to be a psychologist. How would you feel going into a team that may, frankly, wanted doctors as equals?
Mm-hmm.
Do you fall into that white coat mentality where doctors are above all?
So when we're looking at system-wide issues, community-wide issues, a multidisciplinary approach really is the best practice. Even within the healthcare setting, having a multidisciplinary team looking at a patient is the best practice. So no, I don't fall into that white coat mentality.
Thank you, because I presented similar research about a multidisciplinary team, which the previous chairman did not agree with.
Alderman Senna, I never see your hand. Sorry.
Don't worry about it. No. I like to keep them brief. And thank you first for being willing to put your name forward. It's a big undertaking. I think the Board of Health has been challenged more than they ever expected to over the past several years. So, to Alderman Moran's line of questioning, in the process of that ballot initiative going forward, one of the arguments that we heard in opposition was that, well, we have a well-established group here. We get along, we kind of know how to work together. And to the credit of that argument, the Board of Health has been relatively consistent in its membership for many, many years. But, I'm personally and professionally always an advocate for willingness to be open to change. Could you speak to your experience and your willingness to work with new people and hear new ideas, new initiatives?
Sure, absolutely. I'll share a story, and this is going back to 2014 when I was asked to deploy to Afghanistan. Originally, my original mission was to go to Afghanistan to train the Afghan National Army. We were transitioning combat operations from the ANA from NATO to the ANA, and we were training them on a number of different aspects. So when I got to Bagram, I went to the reception desk, and they told me, well, you have a change of mission. You're not doing that anymore. You're doing something else. So immediately, I had to adapt, not only to a new job, but in a country and an environment that I had absolutely no experience with at that point in time. So in order for me to succeed in the role that I was given, I had to learn how to work with different people, agencies that I really did not anticipate to work with, and ultimately it was quite a successful mission for me personally, learning a lot from that experience.
Well, thank you so much for that answer.
Do I have hands? I can't, kind of doing this. Alderman Timmons.
Thank you. Thank you for wanting to do this particular board. However, you and I met a while ago as well, and I really was impressed with your resume. But also, in all fairness, the Board of Health was just reaccredited. And it was reaccredited because the Board of Health worked so cohesively together. It's not because we didn't have enough people on the board, because we did. So my point is, being a liaison from that particular thing, we do work very well together, and I just want the public to know that it was not because we didn't work well. We worked very well together, and it is considered the best Board of Health department in the country. It had to be for a reason. So what we want is someone that will work with us as well as the previous chair and work as a team. But it's not because of the members of the board, it's because the health department themselves, the Department of Health itself, Public Health themselves is doing an excellent job. And I was on the accreditation team, and I just want you to know that's why we're one of the best, and we want to stay the best in the country. And I think you do a great job, and thank you.
Yeah, thank you. Thank you very much.
Anyone else? Okay. Thank you so much for your time. We will be taking up the conversation in a little bit.
Thank you for having me. Have a good night.
Thank you.
Thank you.
All right. Next up, we will call on Francis Nutter Upham, 3 Fulton Street, Nashua, New Hampshire, 03060.
Fran, you can come sit in the seat with us. And I believe Alderman Moran's going to introduce you. Moran. I thought I'm pretty loud. I thought you all.
No.
Okay.
No, you're
All right.
not.
All right.
No, you're not.
I'm not loud enough?
They even say it in the booth.
How's that? Better?
Better.
Okay.
Better. If you just breathe in through the nose and then.
No, I just have to eat the mic. It's good. Okay. Go ahead, Alderman Moran.
Thank you. It's my honor to introduce the Honorable Francis Nutter Upham, licensed clinical mental health counselor, former state representative of 8 years? 6 years, so almost. Who recently has extra time available because she won't be returning to the State House. But during her time at the State House, she served on the Committee for Health and Human Services and Elder Affairs. She is a former adjunct faculty for Lesley University, and of course, a very distinguished history as a mental health counselor in both New Hampshire and Massachusetts. And she was so gracious to give her time today to be considered for the Board of Health.
Okay, thank you. Do you want to just?
Yeah, do a quick intro for yourself and then we'll move up.
Probably a better one.
I mean, he pretty much took all of it,
No, it
but
was
I'm
really
sure
nice.
you can
Thank
add
you.
something.
I've lived in Nashua since 1980. I've raised 4 kids here. You know, I've been on PTOs and church boards and, you know, stuff like that. I went to graduate school in my 40s, wanting to dispel my, anyway, to Lesley University, which was awesome. And I interned at the New Hampshire State Hospital and the Nashua Children's Home. I've worked in private practice. I sort of ended my career in private practice, but outreach, mental health, community health, inpatient hospitals, the Merrimack Hospice House for 3 years. So I've had a broad range of experience with population and with organizations. You asked a question about serving on boards. My other love is art, and I've been a volunteer at the Courier Museum of Art for 10 years, and for one of those years, I did an art therapy program for veterans. both through Zoom during COVID and in person. And I've served on their volunteer board for about 8 years, as well as something called like the Nashua Committee. There was money left over when the Nashua Center for Arts and Science closed, and something wasn't done with it. So I was on that committee to decide how to spend that money in Nashua. I do an occasional workshop now, like on a weekend, art therapy sort of in resilience with veterans, and I'm in negotiations with doing a bit more of that up in Laconia again. I have time to serve. I like being a little closer into Nashua. I really enjoyed my 6 years at the State House, mostly. I introduced and passed a few bills. I co-signed several bills that got passed. I get along with everyone. I've never had trouble finding people from the other side of the aisle to co-sponsor my bills with me. I'm fair, even, funny, easy to get along with. Yeah. Anyway, but I'm serious about the rights of people, what they should do or shouldn't do. I'm very concerned about public health, and it would be an honor to serve on this board.
All right, thank you. We're going to open up for questions, and then I'll ask you my questions, but you answered a couple. Alderman Clemmons.
So I will ask the same relative question. When it comes to the Board of Health, do you think that it has a role in putting out a public opinion about things such as Anthem not carrying insurance or no longer allowing their insurance carrier or people who carry their insurance to go to St. Joe's Hospital and things like that?
I'm not sure about that, because that seems to be more of a contractual issue that's more of a legal thing than it is, should we support wearing masks or not wearing masks during a pandemic. So I would need to dig in a lot deeper. You have to be very careful what you give an opinion about and stay within your scope of practice. And, I've only read a little bit about the St. Joe's issue, and it sounds more for lawyers to figure this out than it is for, public health. It would clearly be a huge impact to our city. Was the number 47,000 people that have Anthem that get services from St. Joe's? Including, I go there once a year for a certain procedure, so anyway. But.
I think it's 10,000
It's
for
10,000.
that specific
10,000.
facility.
It's 10,000.
Oh, okay, all right. I saw the 47,000 somewhere.
It's still an entire ward.
It is an entire ward, yeah.
It's 10,000.
Okay,
Thank you.
Thank you for your
Alderman
question.
Clemmons? Other questions?
Yes?
Alderman Lopez.
So I don't feel like I need to defend anybody or anything, but I just wanted to acknowledge that it's a little bit awkward having, put yourself forward for this position, and then the health department has said, well, we like this guy. So this is the same health department that will serve anybody in need. This is the same health department that goes into the areas of the city that other people don't pay attention to. It's a group of professionals that are very passionate about their work, and they're doing what they believe, expressing what they believe is the best choice for the city of Nashua. Is that a group of people you feel like you can work with?
Yes, I've known Bobby Bagley for several years. I attend all of the things that she invites us to, the mayor's task on mental health or drug use, misuse, opioid abatement, all that kind of stuff. So it's nice that you had someone introduce each of us candidates. So far, people are sounding very qualified, so you're going to have a tough task judging. But I wasn't put off by that. But thank you for your consideration.
I just figured I would acknowledge the office.
Yeah, okay.
Because I don't think any of that was intended, but
No,
I mean,
it's fine.
I appreciate your willingness to serve.
Thank you.
I appreciate the career accomplishments that you have. I feel like some of those might be life goals for me in the future as well.
Thank you.
So, and I think the way that you've articulated your coming to this situation and your desire to help serve, it's proven with your own record of service too. So I appreciate you. As you said, there's some very difficult, oh, not difficult, some very qualified people. And as was mentioned earlier, we're not used to actually having to pick one out of three. Maybe, you know, maybe the referendum will go a certain way and we'll have more opportunity to appoint additional people. That's for the voters to decide. But I thank you for putting yourself forward for this, and I appreciate all of your efforts in the community.
Thank you.
There's no other, go ahead, Alderman Moran. Oh, I didn't see you.
Oh,
That's okay, you
No.
can go first.
Are you sure?
Yeah, you're the
Then
expert.
already-
Intentional in our hands, so I can't tell if people are doing this or actually. Alderman Jettie, and then Alderman Senate, and then Alderman Moran.
Well, thank you. Thank you for getting the special treatment. I know it's because I'm on the committee and for no other reason. So, you know, thank you for being willing to serve. Thank you for your service in the State House. You know, we're going to miss you there, and, you know, we appreciated the work you did for us while you were there.
Thank you.
So when I looked at your resume, you know, I looked at your education and I see that you know, that you went to Leslie with, I mean, well, you went to UNH and majored in art history, and then you went to Leslie and became got a master's in expressive therapy. So I must confess, I don't know what that really
It's
is.
a form of psychotherapy.
Okay.
Yeah.
And I do notice that you are a licensed clinical mental health counselor. And so I'm just looking for reassurance that you feel that you have the, you know, the medical background that this role you know, would need. You know, we spent many long nights here listening to people express their opinions about the effectiveness of masks and vaccines. And, you know, I confessed that I knew nothing about it and that I was relying upon, you know, the advice provided by the three doctors on our Board of Health. And so I don't know if, I hope that never comes up again, but if it does, you know, how would you see your role in trying to guide us in a medical issue like that?
So having served 6 years on Health, Human Services, and Elder Affairs at the state level, our committee was usually comprised of at least 4 or 5 doctors, physicians, of one sort or the other, a few social workers, nurse, whatever. And, you know, we heard all the health and mental health bills that came up in front of us, including all the testimony. So I've listened to 6 years of testimony on all kinds of issues. So I have a broad range. I also have, you know, what was that show where you could call in, make the one call to get the answer?
Who wants to be a millionaire?
Yeah, well, something like that. But so I have,
Phone
you
a
know,
friend.
friends that are, you know, pediatricians, psychiatrists. I have a broad range of contacts that if I have a question about, I can call, which I like. I also, the 3 years that I worked at the hospice house, you know, once a week there was the 2-hour meeting going over everyone's death. So one learns a lot of medical jargon issues. You were aware of treatments that people were receiving or not, you know, whatever. So I feel, for not being a physician, pretty knowledgeable in medical things.
Thank you.
All set, Alderman Jettie? Alderman Senate?
Yes, thank you.
Well, thank you, and thank you for your willingness to step forward and be considered for this position. Not to reiterate my comments, but Board of Health becomes more and more predominant every day, I think, as we see the world develop around us. Something I just wanted to dig into about your about your resume, because I feel as we get into the discussion of the public health issues that, you know, influence public health around us and the social determinants of them, that becomes a really broad spectrum. And something that really stuck out to me was your time with the home health and hospice program, with the Good Grief program, in particular advising on the children's bereavement, because again, these are the little items that I think when we think of the broad topic of public health sort of get overlooked. And you had just spoken to that a little bit. I was hoping you could speak to your experience a little bit more with that particular program.
It's a hard program to work in, and children. It's very hard for children to lose a parent or a sibling, and it was very isolating for them. So Home Health and Hospice, the Good Grief program, had about 4 different age groups, maybe 8 kids. Usually you don't have more than that in a group. And often art-based, because that's how you work with children. And they needed healing. It was healing for them to be with other children who had been through such a dreadful experience as you could. And then later on, I led the group with the parents, and some of my colleagues led the children's group. And the last group I did was probably the hardest group I'd ever done, because we had grandparents who had lost a child or two to drug overdoses, and they were now raising their grandchildren. We had mothers whose husbands had committed suicide, and gruesomely. And it's, you know, for them to go on with their lives, they need, you know, healing and camaraderie and support. And, you know, I'm pleased with, you know, our school systems do a much better job than like when I was a little kid and somebody lost a parent. We didn't have a school counselor back then, and at least now teachers, I mean, I know they're a little overwhelmed with everything, but they know how to refer, and of course Home Health and Hospice does a very good job of advertising their services, and physicians know as well to, you know, recommend that, you know, if they can. Does that answer?
Oh, absolutely. Yeah,
Okay.
no, and I really appreciate the points you spoke to toward the end about referrals within different programs, because to me, that does illustrate an understanding of the vast network that exists out there for public health. And, you know, while one program receiving somebody seeking help may not be the best avenue for them, we rely on them to know their network well enough to refer them to the program that can, and having somebody stepping forward to serve on the Board of Health who has an understanding of that network, to me, is a very strong positive, so thank you.
Okay, thank you.
Alderman Ray.
Thank you. Jumping off of what my colleague from Ward 5 had stated, you know, the previous candidate is not a healthcare worker. He's a CEO of a corporation here. He's not a, healthcare provider. He will be next year. He'll be a psychologist, and he has to do 2 years of clinical supervision to become a licensed psychologist. But there's only 2 healthcare providers that have put their name forth. You and the next candidate.
I see, yeah.
So jumping into that, can you describe more about your work, whether it's on Health and Human Services or another agency that you've been with, where you've had to collaborate with doctors, nurses, and other healthcare professionals to help a patient make healthcare decisions or work in a public health
Well,
arena?
I worked at the Lowell Youth Treatment Center, which was an inpatient psychiatric hospital for children like 4 to 18. And I did 4 groups a day, the young ones and the older ones, 2 groups each. And I worked, sometimes you work well with the psychiatrists, sometimes not so well. But the ones who listened, they would maybe try a new medication on a child. I mean, these are very severe cases that have made it to inpatient. So 2 doctors specifically would have maybe tried a new medication, and they asked me, so how was the child in group? And I could say, well, they were calmer. There were no outbursts. They were able to focus on the task that we were doing. And then we, of course, had collaborative meetings where, I mean, because we're all looking at different aspects of the child through their day, and then we're collaborating, as well as, of course, you know, the hospital notes in the book. But I found them listening to the therapists, and sometimes also listening to the floor staff, because the floor staff is with them, you know, from when we go home to the next morning. So I'm used to working collaboratively where my opinion is respected. Or why would I stay there?
So what I'm hearing is that you're able to use your clinical skills in observing or assessing a person or a community or an organization and
yeah.
providing feedback of your specialty to a treatment team.
Yes,
Similar to what the Board of Health would be.
absolutely.
Thank you.
Yeah.
How's that, Alderman Timmons?
Oh, thank you. Well, hello, I'm very familiar with you, and thank you for stepping up, okay? I do have some questions and some concerns as well. So first, I'd like to know, how did you become aware there is an opening at the board, and you put yourself forward as a candidate? And I was wondering if you can explain who told you and how you become aware of what it entails, and can you speak on that?
I got an email from Mel Moran.
I can confirm that.
Yes.
Okay.
And
We were all
he
literally
said,
invited to do that.
Yeah, right.
he's
Go ahead.
well aware of my legislative work, and, you know, he has testified in favor of some of my bills and whatever. And so he asked if I had an interest, and I thought, well, yes, I have more time. I definitely have an interest, so.
Okay, and I want to congratulate you on your 6 years of service.
Thank you.
I don't know if you know that I'm the liaison for the health department.
I saw your name was on the list of members, but, okay,
Okay.
yeah.
And so were you aware that if I really thought that you would have been a good, not that you're not a good candidate, that I might have called you because I personally know you and talked to you about maybe joining the board? Do you feel that it was anybody the board, or I just want your opinion, any alderman job is to call you instead of the health department calling you to seek you out, or how do you feel about that?
Well, I guess, how would I find out that there was an opening unless maybe I read a newsletter about the city of Nashua every month, which, had I known there was one or found out about. So I was pleased that someone let me know that there was an opening that I might be a good fit for. I wasn't strong-armed or anything. It was just like, are you interested? I am interested, so.
Can I have a follow-up, please?
Alderman Timmons.
Okay, thank you. And the follow-up is, did you read that we were one of the best public health departments in the country?
I did not. I know we're a safe city.
Yeah.
Anyway,
Yeah.
so,
Well, we just got recertification.
okay.
Okay, and it's because of the board.
Mhm.
And also, the board do not necessarily have to have a public health nurse on the board. They do already have, but it doesn't have to be on the committee. Gloria is not part of the health department, but I can be on that board if I get selected.
Okay.
Are you aware of that?
No.
How's that, Alderman Timmons? I'm gonna go to my list unless
Can I
there's-
just ask a clarifying question?
Alderman
Through-
Moran.
Maybe through you to Alderman Wilshire, I believe there was a memo sent out to the full board asking for anyone who might have been interested to send resumes forward. Is that correct?
Yes.
At the direction of the board president?
Yes.
Thank you.
I think he's going to make that point. Okay. All set? I don't want to cut anyone off. I believe you've answered your experience volunteering on boards. Second question was, what do you know about the work that's done in the Division of Public Health and Community Services?
Something about milk.
I couldn't believe that's in there.
I know.
It's in there.
Also, something about public safety of water.
Very interesting.
Yeah. And beyond that, I think I shall learn on the job, should I be so lucky. So,
Next question was, what do you think are the primary health issues impacting public health in Nashua?
poverty. I mean, how many kids go to school hungry, right? Housing insecurity is a big deal. I live in a very mixed income neighborhood, and there's been kids that they've changed schools 3 times because they lost the other apartment they were in, and then they got one across town, or the ones that, anyway. So this is hard, very hard on children. Food insecurity, housing insecurity, job insecurity, and insufficient income, I think, affect everything else that we do. So,
You know, when the board meets and can make that time?
you said Wednesday?
Wednesdays
12
at
to-
12:30.
Yeah,
Second Wednesday of the month.
I'm good.
Okay. You answered this a little bit, but I'll ask it again. During emergency events, the department will be seeking guidance. Are you comfortable with that role?
I am. I also volunteer on the DBART team, Division of Behavioral Health Emergency Response Team. And I've been on that more than 10 years, where we get called out to, if there's a death in a school, we get called in to be available for students or teachers to come talk to us. I've been deployed a few times with that. So, yeah.
Great. Thank you. If there's no other questions, I'll thank you for putting your name forward, and we'll be having a discussion in a bit.
Okay, thank you. And okay, thank you.
All right. Next up, we have Wanda Lanigan, 48 Donovan Court, Merrimack, New Hampshire, 03054.
Alderman Moran, did you want to introduce?
Yes.
Ms. Lanigan?
And just for the record, I also invited Ms. Lanigan to also apply for this position. Wanda is a advanced practice registered nurse, so the only medical provider that has put their name forth for this position. As most of you may or may not know, an advanced practice registered nurse in the state of New Hampshire practices independently from a physician. They are able to treat and provide care just as a physician would in their field of certification. If I'm wrong with that, I'm sure she would correct me soon. She is a associate professor at Walden University, Regis College. She is the owner of Behavioral Health Resiliency in Merrimack, New Hampshire, where she provides psychiatric medication treatment and other psychiatric interventions. She has a long and significant career as a registered nurse. At one point, she was also the director of social services for a large healthcare agency. She has numerous certifications. I'm sure everyone's read her resume, but she is a very well-qualified medical provider who's put their name forward. Also local here to the greater Nashua region, and not so connected to the Nashua politics scene, having nothing to do with politics or large healthcare systems in the state of New Hampshire.
Ms. Lanigan, do you want to give us a little bit of background? We have your resume, but why you put yourself forward and what you'd like to see?
Yeah, so thank you for the opportunity. I feel like an anomaly not being part of Nashua in presenting today, so I really appreciate the opportunity. To dovetail on what Mel said, I did volunteer in Merrimack. I was on the planning board, so I do have some political dabbling, if you will. And there was something else that you said that I was like, oh, I might want to clarify that, but it just escaped me. I started my career as a registered nurse. I worked in indigent communities. I worked in Lowell and Lawrence. I used to go into homes that were covered with roaches, and I had to take care of babies in those situations. I moved into Nashua. I worked at the hospitals, and I continued my career. I am a lifelong learner, and I think that kind of covers the resume, so.
Okay, great. So we'll open it up, and then I'll fill in any other additional questions. Alderman Clemmons.
Thank you. I will ask the same question I asked the other two. Do you believe that it is the place of the Board of Health to opine on issues such as Anthem no longer allowing their insurees to go to St. Joe's Hospital?
So I think it's a really interesting question that can't necessarily be answered in 5 minutes. The reason that I say that is the two-headed monster dates back to Truman. And we have really been grappling with that for decades. It is private insurance, so it is contractual between the organization. And I think the board's role is to make sure that the people who are displaced are cared for. Finding a way to navigate that.
Okay,
Is that
thank you.
other Alderman? Alderman Lopez.
All right, so I'm speculating here because for reasonable privacy purposes, the addresses are redacted. But the ones that are given on the record, one of them is the headquarters of Harbor Care. And I know Henry is very dedicated to his work, but I don't think he lives there. So just because you're from Merrimack, I wouldn't automatically disqualify you personally. I would be looking more for your experiences in Nashua. I saw you're a Riviera alumni. I saw that you've worked at both Southern New Hampshire Medical Center and St. Joseph's, so I feel like that you're on the right track for me. I'm looking for how are you connected to the community? What about this position, particularly, do you think you bring to the table that might be unique? And then, as I brought up with the other candidate, would you be in any way off-put by the endorsement of one candidate versus yourself, or do you think it's an understandable desire to see the best qualified person nominated?
Absolutely should be the best person qualified nominated. The person who can do the job for the people is what's important. And the first part of your question was?
What's your experience in Nashua? What areas are you passionate about? What do you bring to the board that you think would be a very helpful perspective for the Board of Health?
So, interesting question about the passion in Nashua is when I first graduated from nursing school, I had this big design to create a community where we could wrap our arms around everybody and lift them up into equality. And I realized in healthcare that that was a very, very big dream. And I think we can do our small part. Nashua has a lot of opportunity. It is above the curve in terms of the national expectations statistically on how care is provided. I think that one of the areas that we excel is education, and I have a passion for education. So not only am I a lifelong learner, I'm currently in a fellowship, and the way that I practice is really looking for the root cause. And I think some of the issues around housing and food insecurity comes down to knowledge deficits, and we provide resources, and the cost of living and the cost of food is exponential. So people can't eat healthy. They can't do what needs to be done to take care of themselves because we're not supporting them at the base level. I don't know if that makes sense or answer your question.
Yeah, I would just comment that the description of people lifting each other up is a holistic model, which is considered a best practice. So we just need to practice what we preach. And I think it is something we can work for and strive for. I know Harbor Care in the past has endorsed a no wrong doors policy. Any door you go in, somebody should be knowledgeable enough to send you to the one that is your ultimate destination. And I know our own public health director has talked about the importance of interagency cooperation and collaboration in a community approach. So I think you're in good company there. I appreciate you stepping forward with all the other things that you have calling your attention. And I appreciate your willingness to help the community of Nashua.
Alderman Jettie, and then I had Alderman Clee.
Thank you. So one of the things the Board of Health and the Board of Aldermen have in common is the protection of the health of the community. And I talked about earlier about how we spent many hours in this chamber, hearing people express their opinions about the effectiveness of masks and vaccines, and we were, all of us were just trying to do what was best for the community. And as much as as much as we would like to think that that experience is in our past, we continue to read about different types of diseases and variations of various flus and other types of diseases, and so it's possible we could be facing another situation where we as aldermen would have to make a decision about whether to restrict the use of city buildings, for example. And so I'm interested in whether you have kept up with with the news and studies, and there were conflicting studies back then. There still continue to be conflicting studies, and I'm just wondering what personally what is your view on on the role of protecting the public, masks, vaccines, whatever other, closing restaurants, that all those issues, those hot button issues that we faced not that long ago. Is there anything you could say to us that would help us understand what your thinking is on those issues?
I think that it's really important to understand that everyone making those decisions are human beings. They're all dealing with their own thoughts and feelings, their own fears. That was a situation that was just one of a kind, right? And everybody was dealing with the information the best way that they could. And with all research, you can find a study that's going to contradict another one. So you have to really be able to look at all of the studies and make the best choice possible with the information that you have. And I think if you look at how New Hampshire handled that situation and you look at the statistics, the right decisions were made. You're never going to please everybody. It's not going to happen. So just knowing that everybody is doing the best that they can with the information that they have available, that's an important perspective.
Thank you.
Alderman Clee?
Thank you, Madam Chairwoman. I haven't really asked any questions of the other members. Like all the other members, your resume is quite impressive. The only thing that I see differently is you really haven't had much interaction with the community of Nashua, other than it looks like, and maybe I'm wrong, maybe I'm just reading this wrong, except for back in 1998 to 2001. And I'm assuming that was probably during your education period. It says staff nurse at Southern, and it looks like St. Joe's at that time. Was
Yeah.
that when you were going to Revere?
No, that was after I graduated. So interestingly, that was also when I had my first son. And we made some family decisions for me to move away from the hospital and move more into a traditional role. I do have a son who has auditory processing and ADHD, and it was a lot to get him through school. So I did have to shift my focus a little bit, balancing career and family. So my interactions with Nashua have been through my home care work. It's been through working in the hospital. Currently, I do take care of clients who are from Nashua, who attend the Nashua school systems. So I do have clients who come to my private practice from Nashua, and I've always kind of just been on the peripheral.
Okay, oh, so you actually have patients, or clients, I should say, I'm sorry, clients from Nashua that come into your practice. So you do interact in that respect with the Nashua public?
Yes.
And so you do have some of the community interactions?
Yes, and a big part of my practice is adolescents, 20 and under. So I do have a lot of children from the school systems that I treat.
Oh, thank you. May I? Thank you. So then you are familiar then with our school systems and how that, I appreciate that. And you are the only other person that has a clinical background in that respect. And I do like, and I think Alderman Moran brought that out, I do like interdisciplinary type of people on the board. So clinical is good, as well as someone with a social background and so on. I did see something here that it mentions about behavioral health resiliency. Can you explain that?
Yeah, that's my private practice in Merrimack. That's where I treat people. I do medical management for medications for psychiatric patients. I see patients who have mood disorders. I see a lot of ADHD, and I do psychotherapy. And I do a lot of behavior modifications, so it's a lot of education, really empowering people to take their health back. A lot of what we do influences our overall health, not just our mental health. So when we exercise, we increase our neurotransmitters, which makes us feel better. So I do a lot of education with my patients and just trying to modify their lifestyle to be more balanced.
Thank you, Madam Chair.
Alderman Tebow.
Thank you, Madam Chair. So I'm glad Alderman Klee asked that question, because that was kind of where my question was going, or my statement first. I kind of think that it's good that you're not necessarily from Nashua, but you're not that far away. I think sometimes there is a nice, I mean, we have many boards in this city that not everybody on those boards are from Nashua. There's Hollis, there's Concord, there's maybe somebody that lives in Massachusetts. So I don't think that's necessarily a precursor to pushing somebody off of the list. And I think, Merrimack, 1989 Tomahawks, right, me and you?
Yes.
So just putting that out there, we graduated high school together. But growing up in Merrimack, you're right on the border of Nashua. So everything you really go to is in Nashua. The hospitals are in Nashua. Most of the doctors that people see are probably in Nashua, especially, 20, 30 years ago. So I don't think that's a bad thing, and I think, the other two candidates, I think most of us know in some capacity pretty well, just being there. So that's why I haven't been asking questions, but I figured I'd ask one here, because I think people don't know you here as well. So I guess my question is just like, why would you want to get involved in this?
Well, why? If we don't get involved, we don't make change, right? And I'm an empty nester now. My boys are 23 and 21 in grad school, and one's an undergrad just finishing up, and he's going on to mental health. So why not now? Why not now? I have all this energy to give back. Why not? And the opportunity, Mel did send it to me and said, hey, are you interested? It just felt like the right time.
Thank you. And I appreciate you stepping up to do that, because sometimes these boards, there is some political stuff sometimes and pressure and all that, and so it's good to get good candidates. It's nice to have 3 qualified candidates up here trying to get the same position, so thank you.
Other questions? Alderman Center.
No, thank you, Madam Chair. Thank you, like all the other candidates, for being willing to step forward and be that agent of change that you want to see. You'll have to pardon me, I get a little giddy right now when I hear other parents say that, oh, I'm the parent of a child with auditory processing issues or ADHD, because that's something that I'm, excuse me, living through learning about firsthand right now with my 10-year-old. So it's always a pleasure to see that there are people out there who have gone through that and have clearly raised success stories. You mentioned grad school and undergrad. And I'm just going to guess where your experience seems largely in behavioral health and the areas surrounding it, that those 2 disciplines likely intermingle. As a parent of somebody who experiences, behavioral health issues, you speak to that a little bit as a parent and as a practitioner.
Yeah, so that's a big question. I think our paths, we land where we're supposed to, when we're supposed to, right? If we just trust the path, we're going to end up where we're supposed to be. And to your question earlier, I left the hospitals because I ended up at a different place in my life, right? And different priorities. I became a parent, and it was important to me to really put them first and be there for them, and balancing being a registered nurse on the floor where you have to give up holidays and you have to give up weekends. That's really hard. So I made it a career choice, and that's been my path all along, is where does my energy have to go for the best possible outcome? And you can think of it sort of like a grassroots. If you're not making a difference at home, then you're not making a difference in the world. So it's been really important to listen to, sounds kind of weird, but the universe and what it tells me I need to be doing, right? So I moved out of hospice when I couldn't be supporting the kids with their sports. Now, hospice was an amazing career choice. It was the greatest honor I could really have, to be at somebody's bedside and supporting a family as they died. And yet, I had a family who needed me, so I had to make a choice. And that's the beautiful thing about nursing, is you can move, right? You can take your talents and you can give them to people, because people need you no matter where, right? So I moved into a different area of nursing, and then I moved into a different area of nursing, and I just learned. I learned everything I could about every area of nursing that I was in, and that shaped me, and it brought me from the medical world, because as Derek, you said, the world's changed, right? So things became so segregated, particularly after HIPAA, right? You guys talk about the RSA, people don't even realize that coordination of care nullifies HIPAA. We should be able to speak freely as long as we're coordinating care for somebody, right? It shouldn't be a barrier to care, but yet it is. So I moved into the psych realm because we were segregating people. And coming into psych, we unify the person again. We're looking at their medical, we're looking at their emotional, we're looking at their behavioral health. It's a biopsychosocial approach. It's just very different.
Well, thank you for that well-thought-out answer. I really appreciate that.
Alderman Timmons, then Alderman Moran.
Oh, Wanda, right? Thank you for stepping up and wanting to do this, and I really appreciate that you're doing this. My question is, you're very good with the health department and mental health. Do you know anything about the community services that the health department does in Nashua? And can you give me an example how you interacted with the community in Nashua, even though you live in Merrimack, with the community services that we have here?
Yeah, so I worked for Dartmouth Hitchcock for a number of years as a care coordinator. And so I did coordinate services here in Nashua as a case manager. And what case managers do is they get the more complex cases. They're the ones that the doctors go, okay, there's a lot going on, I don't know what to do. And so then we make all the calls and we connect them with the services. We get them connected with housing if housing's the issue. We get them connected with Department of Health and Human Services if Medicaid is needed. So we do a lot of that service connection.
Was that Alderman Timmons?
I'll let him go, and then I have a
Alderman.
follow-up question.
Okay. Alderman Moran?
Thank you. A slightly modified question from my colleague at large. Less contractual. Contractors?
Contractual?
Thank you. You got it. I'm so busy, I can barely speak anymore. So, housing, we all know is healthcare. Director Bagley has said herself, we need more housing in the city of Nashua. Do you think it's in the scope of the Board of Health for advisory opinion that we are in need of housing in the city of Nashua?
Well, if you look at the outline of most of the Board of Health in the state, housing is under that umbrella. So it would definitely be a topic. How far that scope goes, I don't have a good answer for you.
But at least a topic of discussion.
Absolutely.
Other questions? Did you want to, you're good?
You kind of took that out of my, about to ask.
I saw her notes.
If there's other questions, I'll ask the questions I've asked the other candidates. I think you answered about volunteering on other boards, unless you want to add there. I just wanted what do you know about the work that's done at the Division of Public Health and Community Services in Nashua?
So I think of it like a three-legged stool, right? I talked about the biopsychosocial approach, but it's more about making sure that the systems are in place for the public health, that people have access to care, making sure that people are safe.
Okay. And then what do you believe is the primary health issues impacting the public health? I would say I keep adding in Nashua.
I think that the economy is the biggest issue. I think the economy is a really big barrier to people. I think people want to be healthy. I think they want to make healthy choices, and it's hard. The housing issue, I mean, who can afford $2,500 a month? And we're putting entire families into one-bedroom apartments. The economy is the issue.
Okay. You're available on the second Wednesday of the month?
I have flexibility in my schedule. I can make myself available.
Great. And then the last question, we've talked about it a little bit, but we saw specifically during COVID, there's an advisory role to the Board of Public Health. How comfortable do you feel giving that advice in an emergency?
I'm comfortable with that.
Great. Anyone else? Okay, thank you so much.
Thank
We'll
you.
be taking up the discussion.
You get to say your favorite part first.
Why do you guys always pick on me?
It's become a thing.
Applications to license hawkers, peddlers, itinerant vendors license.
There are none.
All right, appointments by the mayor.
Do you want me to make that motion?
Yeah, so we're gonna separate out the Board of Public Health and have a separate discussion, just so that everyone who's listening is aware.
Yeah, so I'd like to make a motion to take the next agenda items out of order to first consider the nominees for the Board of Health. I think we have to vote on that.
But yeah, I guess we'll vote on, are we okay to take it out of order? All those in favor?
Aye.
Any opposed? Okay. Do you want to make the motion to recommend with all the names and then we can have a discussion? So it's in front of us?
So you just want me to throw them all out there?
I think we should.
All right. I'll start the discussion then by making a motion to recommend to the Board of Health the appointment of either Henry J. Osh or Francis Nutter Upham, or Wanda Lanigan, with a term to expire December 31st, 2025.
Heard the motion. Alderman Jettie.
So, I looked at the charter, and the charter says that the members of the Board of Health will be elected by the Board of Aldermen. And, I feel we're really lucky to have three very qualified candidates. And I'm reluctant, as a member of a committee, to vote to recommend one over another. I would rather that we pass this on to the full Board of Aldermen, so that every alderman would have an equal, opportunity to vote on the people. They can all, look. The resumes are available to everyone, I think. If not, we can make sure that they get them all. They can review if they've not watched it already, if they can review this meeting and, see the questions we've asked and what the answers were. And then, make a selection, and then at the next Board of Aldermen, we could, the full board could vote. We could have an election as called for by the charter. I don't know how the president feels about that, but that would be my suggestion. If
Just as a point of order, I did ask this of Corporation Counsel, and he had iterated to me that it would have to be a member at the full board wouldn't put forth a nomination.
So,
Alderman Clemmons.
point of order, yeah, the motion that the clerk made is to recommend any one of the three. And to put that forward, just sort of to get it out of committee. I think once it's at the full board, we would then, somebody would have to make a nomination, like Alderman Moran said. Somebody would have to make a nomination to put forward a candidate, and then we would vote as you're suggesting.
Okay, was that the intent of the motion?
Do you want to speak to this, Alderman Wilshire?
That
I'm
was
happy
the
to.
intent initially, was to have the committee do the vetting and then send it to the full board, and then have the board make a nomination and then vote on that nomination. That's pretty much
Sounds like
how
we're
we
in
do
vehement
things,
agreement
so
that we
it
should
just
send it
made
with
sense
no
to go that
recommendation.
route.
Is that what you're saying, Alderman Wilshire?
What's that?
That we should send it with no recommendation to the Board of Aldermen?
We
It's
could
just-
recommend that we pick one of the three.
So let me just, I was going to say this before we started, but this is an unprecedented place. We haven't been here before. We generally get, we've had the same Board of Health for 25 years. So, typically on an inauguration day, we're, most often reappointing people who have already been there. So I think opening it up and having people from the community come forward was an opportunity to hear from, three very qualified candidates. I am torn personally as the chair of this, because I do feel sometimes that the point is to have the work done in the committee. But we do have most of the board here this evening. So it's a bit nuanced, and I think what the committee would like to do is what we can do. Alderman Clemmons.
Thank you, Madam Chair. Yeah, I do not feel that it is appropriate for this committee to make a decision like that. I think we heard from a lot of good candidates, and I think that, I think this was the place to hold those interviews. I think this was the place to have folks who were interested come out tonight and ask the questions. I think the Board of Aldermen is the place to vote on those nominations and to have each one of us nominate somebody for those positions. Even if the committee was to select somebody tonight, another alderman could still put into nomination another name. And that would be their right, because we can vote. We're gonna have to vote on this. It is an election. So in my opinion, I don't have a preference tonight. I have to think about it, to be honest with you. So I couldn't pick one tonight if you forced me to.
So the motion on the floor would send all three to the board for review. The
For
other
a vote.
piece, for a vote, correct. The other piece to this, I had a discussion with Alderman Timmons about just what the Board of Health, allowing them to see the interviews as well before we make this decision.
I'm sorry, I didn't hear what you just said.
I think it would also be important for the Board of Health to review the interviews that we just had, especially where there has been multiple conversations around how closely they work together. And this is the first time they've had a new, person on their board in decades. So I would, as the chair, like to send out the meetings from this meeting and have them involved as well. So the motion on the floor is to send it with no recommendation. Alderman Clements.
Is the motion, can you repeat the motion? Can the clerk?
So the way I've just drafted it, and I actually.
The way you said it was perfect. You said
Well-
recommendation,
Well, I don't.
appointment of, and then you put all three names.
Well, if I could, I'm actually not sure about the language, which I did read off the script here, which was to recommend to the Board of Health the appointment of.
Yeah, it should be
I
the Board
think
of
what we
Aldermen.
need is a motion to recommend to the Board of Aldermen the appointment of either Henry J. Osh or Francis Nutter-Upham or Wanda Lanigan to the Board of Health with a term to expire December 31st, 2025.
So,
You've heard the motion.
with that being said, I think, I believe that that's the correct motion, because I think what that will do is it will put all three names in contention at the board, and then at that point, we will go around the horseshoe and vote for who we want to, if we do it the way that Alderman Senate has said it,
Okay.
as
Alderman-
opposed to us each nominating somebody.
So,
I had Alderman Jettie next, and then you can go Alderman Senate.
Sorry.
I just want to point out that it's not the appointment, it's the election.
Correct.
Right.
So if you could just change appointment to election.
Now I get even less comfortable with that, because it's not really an election. Election is a,
It is an
is a,
It is
election.
an election.
That's how it is in the charter.
yeah.
I'm looking at the charter. It's in front of me.
Shall elect, yeah.
But then we'd be pushing it forward to the actual day of election, not a Board of Aldermen meeting.
No.
No?
It would be an
It says,
election
shall
of the
elect a
body.
Board of Health to be comprised of 3 members on the first secular day of January 20,
Right.
1915 is what this says, but
Does it address vacancies?
it does not.
Right, so, if I could, point of order.
Alderman Clements.
If I could, yeah. So, we're obviously in a situation where there's a vacancy, and so we have to elect to put somebody in that vacancy. So the motion that is before us would put all 3 names before us on a ballot, so to speak, and we would do a roll call vote on those 3. That's what the motion would do.
Alderman Wisher, I would love your guidance in terms of when we get, what is the normal process for a Board of Health appointment?
It's just, like you said, the people that are on the Board of Health have been on there for so long. I think Dr. Storis was on there
25 years.
25
yeah,
years.
25
yeah.
years ago. And they just find people that are interested, and haven't had a vacancy unless it was the end of a term.
Mhm.
So we haven't seen a vacancy like this. And I think it's kind of like when it's not like an election to the, say, the Cemetery Board of Trustees, where we go around and say, the names. I mean, I think that's how I see the vote going.
Mhm.
So many votes for each individual, and top vote getter gets a seat, right?
Almost
Okay.
like replacing the alderman.
Okay.
Well, it's a good thing we wouldn't
Alderman
have split that
Clee, and
two
I'm
ways,
sorry if
did
you've
we?
had your hand up and then put it down and I got distracted. Put it back up.
No, that's perfectly fine. If I'm not mistaken, I was pretty sure that corporate counsel, and I know he's not here, mentioned that we had to nominate each of them. So we did have to do a nomination process, and then we had to take a vote on them. So perhaps we should just say, put these names forward, and then he can clarify it when we come to the, I do believe that that's what we have to do. We have to technically nominate them.
That's
Am I correct?
Which we usually do on Inauguration Day.
Right, which is what we're
doing.
going to do,
That's what we're
exactly.
doing.
And
Yes.
we're going to nominate them, and then each of us will vote on which one we want, and then we will do that. So I think it's just going to be a proper, so what you're doing, you're putting the names forward, and then 3 people with 3 members will nominate each one of them to make it official.
Alderman Tebow.
Yeah, I mean, thank you. I look at it as like when we had a vacancy for alderman, and we did the same thing. We went around, we had 2 candidates sitting there, and we listened to, or 3 candidates, I think. We listened to them, and then we each went around, we talked about it or whatever, we went around and voted. So I feel it's very similar to that process that we had, 2 years ago or a year and a half ago.
I think after having the last 15-minute discussion, we should probably update some of the language in the charter to address when there are vacancies on the Board of Health. But it seems to be the opinion of this board that we should send your current, will you read your current motion one more time, please?
Absolutely. My motion is to recommend to the Board of Aldermen the election of either Henry J. Osh or Francis Nutter Upham or Wanda Lanigan to the Board of Health with a term to expire December 31st, 2025.
All those in favor?
Aye.
Any opposed? Okay. We will find out at the next Board of Aldermen meeting. Thank you for your time.
Now we can take this.
Okay, yeah.
All right.
We'll just do the rest, the whole list.
Oh, that, and then
Yeah.
those. Okay. All right. So we get to. Next, I'd like to make a motion to recommend the reappointment of Joshua J. Nahili to the Zoning Board of Adjustment with a term to expire September 11, 2027. To recommend the reappointment of Sherry Dutsey to the Conservation Commission with a term to expire January 1, 2028. And to recommend the reappointments of Adrian George with a term to expire October 31, 2027, and Michael Turcott with a term to expire January 7, 2028, to the Environment and Energy Committee.
For discussion on that motion, Alderman Lopez.
Those are all lumped together, so I'd like to make a motion to amend that by removing the first reappointment.
You'd like to remove the first, so
Yeah.
only reappointments in this. Yes?
They're all reappointments, but.
Yeah, so I said remove the first in the list. Let me just read it for you. Joshua J. Nahili, I would remove him from the list of the whole group that you just nominated for reappointment.
Everyone understand that motion? All right, all those in favor?
Aye.
Aye.
Any opposed? Okay.
So we amended that to remove that name. Now we
Can you
would
please
vote
reread?
for the amended
Haley?
list.
Certainly. So you want to start with that one? Start at the top, or?
Did we just vote only on the amendment just now?
Mm-hmm.
Okay, sorry.
Yeah. So we amended the motion.
So let's vote on the amended motion.
And
without
just as a
looking
point of clarification, if people want to discuss that, that's fine. I just wanted to take him off the list so that we could address that specifically.
at- Is there discussion on the? We just passed the amendment, so.
I
Is
just
that what you were
gotta-
gonna say?
No. Thank you. I don't know, I find that weird that we, and I know I'm not on the committee, but we lump everybody that wasn't here, we're just gonna say probably yes to them. And then we got another one that actually came forward and answered questions, and we're taking that one to the side. It's like, shouldn't they all be kind of addressed, like, on their own merits, like, separately? Like, I feel weird about that, but.
It's a great question. It's something that this board has worked through a lot. We've had discussions around reappointments and how we clarify that. This committee gets the list, and if there's specific people that they want to talk to for a reappointment, we have them come forward. Some of the comments were, oh, I've never seen this person because, they were appointed 25 years ago. So knowing a little bit more about, what's going on with that board was important. So the committee is able to ask anyone who's up for reappointment to come for an interview. So in this case, Mr. Nikili was asked to come in, the others were not. Okay. All those in favor of the amended motion?
Aye.
Any opposed? Okay.
All right. Next will be a motion to recommend the reappointment of Joshua J. Nahili to the Zoning Board of Adjustment with a term to expire September 11, 2027.
You've heard the motion. Is there discussion on that motion? Alderman Jettie.
Yes, I'm going to vote for Mr. Nahili. I've watched him, on the Zoning Board of Adjustment. I think that, I think he has done his job. Remember, the people on the Zoning Board of Adjustment are, you've heard me talk about it's a quasi-judicial board, but they're not judges. They're not lawyers. They're like members of a jury. And, but, my observations of him is that he has, largely, looked at the law and tried to apply the facts of the case to the, under the constraints of the law, tried to make his decisions from what I've observed. I haven't seen them all, but he seems to try to make his decisions based upon, the law as applied to the facts that are presented. And I thought, the way that he answered very pointed questions tonight, I thought he indicated that, that he's going to do his best to continue to do that and try to, make sure that in the future that, if a mistake was made on that case, and let me tell you, I've tried a lot of cases. I've seen, what it's like in a courtroom. Cases get presented by the advocates, and, witnesses testify. And juries are sitting there trying to judge the credibility, of the various witnesses. They're listening to the lawyers. They're trying to see, who's making the most sense. It's a complicated process. Trying to go back and second guess what happened, where you have, sounded to me like there was a conflict between what, what the members of the zoning board may have, interpreted, and what Corporation Counsel, told us. There was a lot going on, and I think, unless you were there, unless you sat through the whole thing, it's difficult to second guess, how that case was handled. So, I gave him the benefit of the doubt. I think, I'm comfortable voting for his reappointment.
Thank you, Alderman Jettie. Alderman Lopez.
So as I stated in the question and answer period, I don't agree with the decision that was made, but that decision was an aggregate decision made by the zoning board. So I don't blame Mr. Jahili specifically for that. I do note that he voted as best he could with the information that he had. That being said, in the interview part where we're talking about, did we recognize that when legal reaches out, that's something we should probably listen to and attend to? I'm not confident that that has gotten across, and I don't blame him specifically. I would state for the record that I would plan to vote against the nomination of any of the current zoning board members, because I think it needs to be clear that if legal reaches out to any of our volunteer boards, you have to stop and figure out what they're trying to say if you're not sure. It's very important not to get the city into additional litigation, that of all the things that we could blame for wasting money and, by the taxpayers on, X, Y, or Z thing, we have an explanation for most of it, but just like not following the rules is not a good one. So that's where my position is. Now, in the same way that I'm not going to summarize all of his work by one decision, I'm kind of trusting that the rest of the board will have their own perspectives, the Board of Aldermen. So I just want to clarify that I plan to vote against his confirmation. And I'm going to do it in the full board, so I don't think it'd be right for me to vote a different way here. But again, I don't summarize, I don't want to reduce all of his work to one decision on one topic or one issue. I just think that we need to be very clear that we have to follow that. So, I see the parallel that if the zoning board voted as a group, then the whole group needs, in my opinion, to be aware of the seriousness of this, because the consequences are real. Not just the consequences to the taxpayer, but the decisions that are being made about how a space is being used, a privately owned space can be used. That's something that always needs to be very well supported and very clearly thought out. With regards to the only recent awareness that there was news coverage of this, that's a problem we're struggling with as a city. I think the Union Leader was where I saw it, and that's sort of an annual edition at this point. And I will probably do some question and answer with legal over the next week to confirm what communication was had with the zoning board, because if they really only sent one email and he wasn't updated like, hey, you guys are about to do the same thing we just settled on again, then that's something I need to do my due diligence on. And then likewise, I had watched the YouTube of it, and I thought it had been brought up, but I might have misheard or misunderstood. So, those are things I plan to look at when it comes to before it comes to the full board. But for tonight, I'll be voting against his appointment.
Open Senate.
Thank you, Madam Chair. Excuse me. I share a lot of the same concerns as my colleague from Ward 4. The impression I come away with from the interview that we had with Mr. Nahili is that, what's the best way to put this? I feel like there's a bit of a he said, she said aspect to this, because, and any of my colleagues here can correct me, but my takeaway when we were first made aware of the legal impact of this decision by the zoning board was that Corporation Counsel or a member of the legal department stayed late following normal business hours here at City Hall in an effort to make that contact with the members of the zoning board, and it was still declined. I think Alderman Lopez was astute in indicating that during the interview, we had to sort of accept the statements as they were presented, but nevertheless, just because one person says one thing doesn't suddenly make what Corporation Counsel shared with us to be not true. And so I'm struggling with that, because if that were the case, and somebody were here present right up to the point of that meeting, I don't see a reason why that discussion couldn't have taken place as members arrived. I understand schedules are tight, but I also struggle with the fact that in spite of the fact that that conversation didn't take place, there was still a legal opinion presented that was ultimately voted against. I'm not sure at the immediate moment how I plan to vote this evening. I certainly don't know how I plan to vote at the full board. I think this evening my inclination is to give Mr. Nahili the benefit of the doubt. There's only 5 of us that actually get a vote here this evening, whereas we have, as mentioned earlier, most of the board here. They've heard both sides of the story, so to speak, and so my inclination is to give everyone the benefit of the doubt and send this up to the full board, where ultimately everyone has the opportunity to have their say.
Alderman Clemmons.
Thank you, Madam Chair. So this is not an easy decision tonight, but I feel comfortable moving forward with the nomination after the discussion that we had here this evening, because to me, what I heard this evening was that somebody who recognized what was probably, ultimately what was a mistake, but that, you know, in the future, they're going to look for, they're going to look out for things like this. I don't see this happening again in the future. I like to give people the benefit of the doubt. Everybody makes mistakes. No one in this world is perfect. It ended up being a pretty expensive faux pas. It could have been a lot worse, however. But, you know, we are all human, and we're all here to do what we feel is in the best interest of our city. And while I have serious concerns about the decision that was made that night, including even from the conversation that we had here and why the decision was made, I still believe that you give someone the benefit of the doubt. And I've said this before, and I will say it again. No one, whether you're elected like we are, whether you're appointed, whether you volunteer for this city, no one wakes up and says, what can I do to piss off half the city today? It just doesn't happen. And so you have to give people grace. And so I was comfortable with the conversation tonight, and I completely respect my colleagues who may feel differently, but for me, I think that I got the answers I wanted, and I feel comfortable moving forward with the nomination.
Alderman Clee?
Thank you, Madam Chairwoman. I appreciate everything that's been said here, whether I agree with it or not. And I appreciate the words of the last speaker, because I've been on this board for not as many years as many of the people that are here with me today. But the one thing that I've learned is that I am the least perfect person on this board, and I make mistakes. And but for the grace of God, I could have made a mistake in a decision that I've made. I know I made a mistake in a decision that I made up in Concord, and I would hate for someone to say to me, you can no longer do what you're doing. So I believe that Mr. Nahili and some of the other ZBA board members made a mistake in their decision. I think it was a costly mistake to the city. I do think that we should give him grace and a second chance. I think his answer was, I don't get to make a decision here. I will make a decision at the full board. I hope that others do, and I know that I sit amongst other board members that have made mistakes, and I hope that they will realize that as well. So I hope that there are positive recommendations that go forward, and that we all realize that we are imperfect people. And while this was a costly mistake and truly an embarrassment as well, and I apologize for using that word, because I don't think, as my colleague pointed out, no one wakes up and says, I'm going to do something that's going to cost the city, the taxpayers, or anything of that nature. But it happened, and we move forward, and we learn from that. So, thank you.
Alderman Moran?
I think the most important thing, too, is that the people's elected officials get to ask very pointed questions regarding that mistake by the ZBA. And ultimately, we're the ones elected to make, confirm the mayor's appointments. And without this body re-interviewing applicants, the people who are listening and wondering why we had concerns about their decision can now readily go to YouTube tomorrow, and if they haven't stayed up tonight to watch it, to see these the questions asked and how the person answered.
Okay. I'm going to support this nomination. I think that one of the biggest things that I have learned as an alderman, when you walk in that door, you're also a volunteer. You have the knowledge of whatever you've brought from your background, but you are essentially a volunteer. And you learn over the years who to reach out to, how to do that job. You're continually adding to your expertise. And I think
we have a volunteer board. They come forward and give their time freely. And it is, what I wanted to hear was, I heard there was a mistake. I know how to move forward. I know how to use the resources that are available so that these mistakes can be, potentially mitigated in the future. Because the work that we do on this committee and as aldermen is, we're all here to just make Nashua a better place. So I was impressed with Mr. Nahili's answers, his ability to sit here very calmly as he was being asked very pointed questions. I think that in itself is a credit to the work that you do at the ZBA, and I'm looking forward to confirming your nomination. All right. So the motion before us is to recommend the reappointment of Mr. Nahili to the zoning board. All those in favor?
Aye.
Any opposed?
Nay.
Motion carries. I am going to take a 5-minute recess before we go on to new business.
Tom.
Oh, where did Tom go?
He's out in the hallway.
Tom Lopez.
Tom Lopez.
Tom Lopez, Alderman Lopez.
You're holding up the meeting.
Tim, could you get Tom?
Thank you, Tim.
No, it was,
If that was you, I forgot Tom. Okay. We are at unfinished business.
There is none.
New business resolutions.
There are none.
New business ordinances.
We have before us O-24-044, increasing the blind tax exemption and the disabled tax exemption and qualifications. At this time, I'd like to make a motion to recommend final passage.
Okay, motion on the floor is to recommend final passage. Alderman Moran, would you like to speak to your legislation?
Yes, thank you. Basically, it has become customary for me to, after the elderly tax credit legislation comes up, to reach out to Corporation Counsel to mimic the same for disabled, deaf, and blind, and that's what we have in front of you today. A little bit later on, we're going to be talking about the elderly senior tax deduction exemption as well, but I do have an amendment I would like to make, which I believe I can as the prime sponsor.
To this one in front of us?
Yeah. Is that correct? Yeah.
Yes.
I know I can't do it for the other one, but I would love the support of Director Cummings and the assessing department before I make any amendment, if that's possible.
So why don't we leave the motion on the floor and have the discussion, and then you can make the motion.
Great.
Did you want to come up and speak to this?
If you'd like us to come up, we're available.
Please. Sounds like you're requested.
And just by point of explanation, as you heard from a member of the public, former Alderwoman Johnson, thank you. She and I have met with the assessing department about creating 2 tiers, married and single. I think it's a great idea. I actually do, because almost every other town does it. But if we're going to end up changing that later on, we should, as it was just recommended to me, to change this disabled to follow exactly the income requirements of the elderly. So I would heed the opinion of the assessing department on what that married figure should be, if at all, before I make an amendment.
Do you want to speak to that? Or
With that being said, Madam Chair, if I could, again, for the record, my name is Tim Cummings. I'm the Director of Administrative Services, and I'm here before you this evening to support Bob Gagney, who is to my right. For those of you who may or may not know, Bob is our contracted chief assessor through the Whitney Consulting Group. He is a retired chief assessor from the city of Manchester. He joined us about 4-ish months ago now, thereabouts. And so I asked him to join us this evening because I believe there might be some technical questions that arise where I thought his expertise would be beneficial for this body to hear. So with that being said, I'd like to hand it off to Mr. Gagney to talk about the current legislation before you, and then if there's questions about the amendment, we could go from there.
Mr. Gagney? Thank you, Director Cummings.
So the question is, I did a report and analysis of what other cities and towns were doing regarding the option of having the married limit for income higher than the single, which is allowed by law. I took a look at Amherst, Bedford, Concord, Derry, Hollis, Hudson, Londonderry, Manchester, Merrimack, and Salem. And of all those towns, they all have a higher income limit for the married than they do for the single. And it ranges from about 9,000 more to about 22,000 more, but most of them are in the $15,000 to $18,000 range. So if you're considering a different level, that married income should be, and it's up to the governing body, somewhere in the 15,000 to 18,000 to be comparable to what other cities and towns are doing.
Okay. Thank you. Alderman Moran.
All right. With that, I would like to amend my legislation.
Did you make a motion to?
We have final in front of us right now.
Did you make a motion for this?
Yes.
Okay.
For blind and disabled.
Okay.
Yeah, we're on O24, O44.
Let me go to,
A24.
I'm sorry, let me just make sure I say the language correctly. Where are you? Essentially, in the language that says what the single is, to change then there should also be language that says married. I would want to change that dollar figure to $75,000.
We've heard the amendment.
So the single would remain the same at the, what is it, 57, and then married would add another 18,000, which is the high end of the average, for married couples to be at 75,000.
Okay, you've heard the amendment. I see lots of opinions. Alderman Lopez.
I just want to clarify that I'm going to abstain from this because I don't think it counts as a benefit, but I am blind, so I don't want to create any concern about dual interest.
Alderman Senate, then, did you have your hand up, Alderman Clones? Okay.
No, I'm patiently waiting.
Okay.
I just wanted to clarify to the maker of the motion, I'm looking at the legislation before us. This is under section 259-9, the qualifications, part A, number 1.
Yes.
295.
295, I'm sorry.
See.
I'm going a little cross-eyed.
I only have the analysis in front of me, so I can't find.
Qualify soon.
I have a question to Alderman Wilshire. Can Alderman Lopez abstain? He doesn't have any monetary
No, he has no monetary
gain.
gain or.
I'm just concerned about, it's a 5-person committee, and if you abstain,
I'm not going to vote on it, so if you want me to sit here then and not say something, that's
I
fine.
think you
Point of
legally
order.
cannot abstain.
Point of
Alderman
order.
Clemens.
Do you take the tax credit?
If I'm eligible for it in the next year, then I would feel like there's a conflict.
Yeah, but do you take, well,
This isn't going to be for this year.
Okay. Alderman Jettie.
Thank you. So I had prepared a similar amendment. You know, it was for a different amount, but I'm okay with the amount that you came up with. And I want to explain the reason for it. And that is, I did look at, you know, as was pointed out, you know, just about every other town in Hillsborough County differentiates between married and single. And when the law was originally written, you know, the enabling legislation, the RSA, you know, it provides for, you know, a different amount for single than married. And, you know, and that makes sense to me. I think at the last meeting, I started to talk about this. And, you know, my research indicates that, you know, I just want you to think that, you know, when you're talking about the, you know, what we're talking about is what income does the person have, you know, from which to pay the tax. So we're talking about it, in this case, we're talking about the blind and disabled. You know, we'll be talking about the same thing when we talk about the elderly tax exemption. So we're looking at these people and we're saying, you know, how much money do they have to pay the tax? You know, and when you look at their income limits, you know, if you say, you know, like 57,000, you know, we're thinking, okay, so you have, you know, a single person from that, you know, 57,000, you know, how much money do they have to pay the tax? And then if you say, okay, well, if it's a married couple, well, they still have the same, you know, if they only have the minimum, they still have that 57,000. But, you know, instead of just that 57,000 being used to support one person, it's being used to support 2 people. And, my research indicates that, for someone, I did this for the elderly, for someone in their 70s, the average healthcare cost for a person in their 70s is $9,526. This is for New Hampshire. And their average food cost is $4,402. So that comes out to $13,928, approximately $14,000 extra expense that has to come out of that $57,000 just to live. So a married couple doesn't really have, if they're both living on that $57,000, there's not as much money with which to pay the tax as there is, a single person. And the fact that almost every other town in Hillsborough County and almost every other town in Rockingham County, makes that distinction. And, as Mr. Gagné pointed out, in some cases, it's much, the distinction is quite substantial. So if you look at it that way, it makes sense that, a married couple would have, a larger permitted income before they would lose eligibility for the exemption. And, the number 75,000, is in the ballpark, so I have no problem with that. So I'm going to support this amendment, and I hope I explained my reasons to you in a way that you understand my what I'm trying to tell you. Thank you.
Mr. Gagné?
Point of clarification, the income and asset limits only apply to the disabled exemption and the elderly exemption. There are no income or asset requirements for the blind.
Okay.
Yes, I know that.
Just to make sure you understand that. It will make a difference on whether Alderman Lopez can.
Yeah, that actually literally does help. So I guess I can vote
Alderman
again.
Lopez can vote on this. Okay. I saw Alderman Moran and Alderman Govea.
Great. Thank you, Madam Chairwoman. So we spent, I think, at least an hour talking about this. Former Alderwoman Johnson came very prepared. I think she brought it up last summer, and afterwards I met briefly around the budget time with Director Cummings, saying that we would meet before this budget season to discuss it. And the team there did a great spreadsheet on what's going on in other towns. I just, overall, you have I know the word elderly is a point of contention, but senior citizens, they're working more than they've ever worked before. They were promised a life of being able to survive on Social Security with their Medicare and whatever maybe small pensions that they might have. This does not benefit wealthy senior citizens who are sitting on a ton of assets or cash flow. This is for working class folks. These people are still working. Some of them may, oh, you know what, we're talking about the disabled legislation.
I was just going to say, Alderman Moran, we're
I'm
not
sorry.
to that.
Yes, so a little bit different conversation because we have to mimic the legislation, but I guess I'll save that for later. But I think it's a very important thing that you're looking at 2 people with basically one income, especially if you're disabled, especially if you're elderly. You're not in the same income brackets as you were when you were working and physically able to get higher earning jobs and stuff like that. So I asked my fellow board members that, and I said this to the member of the public who helped form this legislation, sometimes the people can be off-putting, but, and it's not anything I wouldn't say to someone directly, which I did, but she's advocating for something that's very important, and I happen to support it, and I believe in what she's saying. So I hope, whether it's disabled or elderly, that the members can support this change.
Alderman Govea?
Thank you, Madam Chair. I think with this legislation, and obviously I don't have a vote on this committee, but the one thing that comes to mind with the amendment at hand is the lack of a revised fiscal note on this. And I mean, if I was on this committee, I would have a very hard time approving an amendment that I don't know how much it cost. And that's kind of my holdup. Not saying it's right, not saying it's wrong. I totally understand where this is coming from. I just personally couldn't go back to my ward and say, oh, well, I approved this addition to the exemption, and I don't know how much it cost, but, you know, we're doing it. I just, signing on to a blank check for me doesn't pass the smell test. So I'm a little hesitant on it now, obviously. You guys are a committee, you could pass it. We could probably get some numbers by the time it hits the full board, but just supporting it blindly would be very difficult for me at a full board level.
Pun intended?
Ironic.
Sorry. I had similar concerns. I know we have hands up over here. Alderman Clee and then Alderman Tebow.
Madam Chairman, that was actually the note that I wrote as well. I don't have an issue with going up. I just, I wish legal counsel had been here. I remember legal counsel had mentioned something about, and I wouldn't have had a problem with this going up higher on the single, more than the 57 originally. I actually had wanted to go up a little bit higher on that and not necessarily had done this. I do remember at one point, the reason why the city had gone from the married, having dual, because at one point we did have a dual, to single was because when there was a loss of a partner and you had to go down to single, there was an issue with the going down and income staying the same. For instance, if one of the partners would continue to get the pension and so on, the income kind of more or less stayed the same. And now you're just one single person. And I don't know the exact, but there was legislation that brought it from being a married to having a dual system down to that, and I wish legal counsel were here to kind of give that. I wish that I had mentioned that to the maker of this amendment, and I don't have the exact reason for it. I would not necessarily oppose doing this. I would want to see the fiscal note myself. I was never in a disagreement with the person from the public who brought this forward, but I think we need to hear the reason why the city changed. Just because others do it, as my mother said, just because everybody else jumps off the bridge doesn't mean we necessarily have to do the same. So I really would like to know why we wanted to make sure we were protecting all of our citizens. So I think that's something. I don't know if Mr. Gagnon has any idea why we would want to stick with a single versus a married, maybe pop up the single a little bit more, or?
Well, I would share a couple things.
Okay, thank you.
If it's a married couple and one of them passes away, you don't maintain your same income, because you're going to lose one of those Social Securities.
Right.
Okay. You might include the pension if that's how you took your pension.
Yeah.
Like when I retired, I took a lower amount so that if something happens to me, my wife does collect that. But you can't make that option with Social Security. So you are going to lose, you know, if someone's getting $20,000 a year in Social Security at the lower amount, that's going away. There was another thought I had. Oh, as far as the fiscal note, I don't know how you would measure that, because we don't know how many people would qualify under the new additional limit. All I could say is it's going to be more. But I would not, you know, my office would not be able to give you a count. My experience in Manchester was we didn't have a lot of people drop off because one of the couple passed away. We didn't have a lot of people drop off, and we had two different limits.
Okay.
And your asset limit is the same for both, but it could be different. And for the assets, you don't lose your assets when one of the couple passes
Right.
away. The law provides that if they qualified as a married couple, the widow or widower continues to enjoy that higher limit if the married limit for the asset is higher. So,
Okay. Follow up, Alderman Clee?
Yes. No, I understand the Social Security. I know that doesn't change, but there are pension issues, life insurance issues, and it might be just that they lose it for that particular year or 2 years if there's a life insurance payment or of some sort. I think that may have been what it was. Not having legal counsel here, I don't know. I know there was an issue. The reason why we changed it from having had a dual system to a single system, but I'm not going to oppose this. I just want it to be clear. I know there was a reason, and I would like to know what it was.
if I may, do you recall when that happened?
Long before my time. I don't know if Alderman Clemmons or Alderman Wilshire were here, so it was probably before their time. But I do believe legal counsel had been here at that time, so.
Okay. Alderman Tebow, and then I have Alderman Jettie.
Thank you, Madam Chair. Just to Alderman Clee's point, I would kind of be curious to, like, what the motivation was to be different than the other towns and cities. But I wouldn't oppose it, but Alderman Govea beat me to the punch, because I was going to say the exact same thing. And I know we might not be able to get an exact number, fiscal note, but most of our legislation comes with some form of fiscal note, like this one does, to kind of give us some idea of how much money we're going to be expending. Again, I don't think I would be against it at that point, but I think we have to do a due diligence of something to show something of that. And again, I don't vote tonight, but I would like to see that before it comes to the full board.
And just a point of order on that, if I may.
Go ahead.
Thank you. We just got the data in yesterday, so there was no time to send it to legal to get a fiscal note back on what the change on varying scales.
Alderman Jettie, then Alderman Lopez.
Yeah, so I hope you all know me well enough to know that, I feel, it's more important to make the right decision based upon all of the facts than to, rush into something that we may regret later. And, I feel that this is the right thing to do, but I feel more that everybody ought to have the information they need to make the decision they need to make. Hopefully you'll agree with me when you get it, but I think it's more important that you get the information and that you can vote, with knowledge as opposed to, what you think you might remember from whenever. So I would move that we table this and that the chair specifically ask legal to come to the next meeting and prepared to answer the question about the revised fiscal note and Corporation Counsel probably was an alderman when this change occurred, and maybe he could answer or maybe they could research as to what the motivation was to make it the same number as opposed to the two different numbers.
Motion to table is non-debatable. Alderman Clemmons.
It is, but, okay.
Parliamentary inquiry.
Madam Chair.
When has that ever been the case?
Mr. Cummings wants
Alderman, oops, you're not an alderman. Director Cummings.
Thank you. I just wanted to clarify one quick thing, which is the fiscal note is not provided by Corporation Counsel. It's provided by CFO and the finance team. So I can work with them to try to develop those numbers. I just want to make sure that that's understood, that legal might be able to speak to some of the background and institutional knowledge to how we got to where we are today with the current language that we use. But I'd be happy to work with the finance team on the fiscal note.
Motion is to table.
Thank you for that correction.
All those in favor?
Aye.
Any opposed?
Nay.
That motion carries.
Can I make a comment, please?
Alderman Clemmons.
We probably should have amended that before we tabled it to reflect the new amount. So I'm going to suggest that we still take the other one off the table and do that. Because I think whoever is doing the numbers is probably going to want to know what numbers we're using. So I don't know if we want to retake that off the table to maybe do that, but.
So, but here's my point, is that anytime before legislation comes, you can do the research for your amendment and bring it forward. And if we have the right people in the room, we can better assess it.
True. I just think maybe we should agree on a number first.
Unless you wanted to come up with an algorithm.
It's too late for algorithms.
Yeah, well, that's why I'm saying we should at least start with a number. They can't
And
calculate a
table it,
fiscal note.
How does the committee feel about Alderman Clemmons? Alderman Jettie, Point.
So it's hard to agree on a number if people are hesitant, without knowing what the fiscal impact is going to be. They may agree to, 71,000, but not agree to 75,000. I think we need to get some numbers, so when we talk about the number, we'll know what we're talking about.
Dr. Cummings?
Yes, and I apologize, but I think the point being made by Alderman Jettie just leads me to want to hearken back to what Mr. Gagny said, which is we'll be able to potentially provide you an order of magnitude, but we don't have a crystal ball, and we don't know who's going to come out and try to get accredited so they can take advantage of this benefit. And so we will do the best that we can so you can have an understanding of what the number potentially could be. But people need to understand that this is a best guess that we can provide you.
Thank you again.
Tabled in committee.
All right. So, based on who's in the room, I will make a motion to remove from the table O24, O40.
Motion is to take O24 or 40 off the table. All those in favor?
Aye.
Aye. Any opposed?
All right. Now before us, we have O24, O40, amending the ordinances regarding individual sewage disposal systems. I will make a motion at this time to recommend final passage.
Motion on the floor is to recommend final passage. I know we have, is there anyone? Yes. Thank you. Thank you for raising your hand. It is getting late.
Good evening, everyone. My name is Ren Bodwin from the Environmental Health Department, here to speak about O24, O40, the individual sewage disposal systems, and happy to answer any questions you may have, or even to explain anything that isn't clear.
If you wouldn't mind just giving us like a 2-minute explanation.
I will do
It
my
is
best.
very specific.
Yes, so septic systems in Nashua, most of Nashua is on sewer except for the outskirts of town. Believe it or not, we still have probably well over 1,000 systems that are still on their own sewage system. So this is a very old ordinance, probably hasn't been updated really probably since the 70s. So a lot of the language is outdated. So this is mostly to update that language, update fees that haven't been updated in about 16 years, to kind of modernize this ordinance a bit to reflect the state statutes as well as the state codes that essentially govern the Subsurface Bureau. There are a couple things in here that are a big change, let's say, to the state. So recently in September, the state changed their code for what's listed in NRO 255, Section G, which is all new for that vertical separation. So really what that means is when we're digging into the soil, we're using soil science to see exactly where the water table is in that soil. So when you're building a septic system, really what the primary goal is that when that system is put in, the groundwater is safe from whatever human waste is going into that system. So historically, New Hampshire has always been at least 4 feet because that's how treatment happens. So really what you're using, if you do not have a wastewater treatment plant, if you have your own system, you need to make sure that soil is doing its job to remove the bacteria, the viruses, the parasites, everything that is in human waste. And it does that primarily through the soil. So you need to make sure that you have a primary distance in that soil at the bottom of that septic system, which has a little bit of sand and a little bit of gravel that creates all these biofilms and other mechanisms that keep that soil safe. And so by reducing that at a statewide level from 4 feet to 2 feet is against science that says you need at least 3 feet, at least for the viruses and everything else that is there. So all the data that is out there recommends 4 feet. States that are like around us, Massachusetts with Title V has 5 feet. There's a lot of towns that within our state that also use 5 feet because of where they get their actual drinking water from. So I would like Nashua to remain at the 4 feet that it was prior and historically based on science. That's really one of the only major changes that is in this.
Thank you. Questions from Alderman. Alderman Clemens.
Yeah, my question is around that topic. So I don't see that there was anything in our ordinance prior to that about how far down that had to be, whether it's 4 or 3 feet. Is that correct?
That is correct. So historically, we've been using whatever the state has had in ENVWQ 1000, which is the septic system code.
And so, and you probably said this, but did you say that the state codified through legislation 4 feet?
So historically, in the code, which is not under statute, it was always 4 feet, except for a failed system, which was 2 feet. So what they did is they amended that code this past year at the State House to remove that 4 feet and put it at a standard 2 feet for everything. And when I reached out to the Subsurface Bureau, the administrator and the compliance specialist, they did not have an answer for me. In fact, they didn't even get back to me. When I reached out to the compliance specialist, I asked him, he did not have an answer. He said he would get me one, and he never did.
So,
Alderman Clemens.
yeah, so if I could follow. So traditionally speaking, in Nashua, if I was to go to one of these, to any home that has a septic system in place, what you're telling me is that from historically, that septic system should be 3 to 4 feet down, is
Yes.
essentially what you're saying.
Correct. So all systems are currently 4 feet for a traditional system.
Okay, so this legislation would not impact substantially a home that exists now, because that septic system that is there, so if somebody's replacing it, should already be theoretically 4 feet down.
Correct.
Okay, that was my question. Thank you.
Alderman Jettie.
So among the changes, this 255-48 F talks about charges. And it says charges for sewage disposal approval shall be as follows, and it's raising the charge for test pit from $40 to $50, for plan reviews from $35 to $50, and final inspection, now called bed bottom inspection, $25. So when you said that this hasn't been changed in a long time, my first thinking is, are these charges reasonable, or are we charging what it's costing us to do this work? I mean, is this fair?
Yeah, it's an excellent question. So although we have a lot of systems in Nashua, once the systems are built and they're in place, they're going to last 30, 40, 50, 60 plus years. So we're not doing a huge amount with this actual program. I see anywhere between 20 to 50 systems per year. The least amount of time is that final. That's just me to go out, look at a giant hole that's been scraped out. Most of the time is the plan and the test pit where I actually have to go out there and survey the soil. We got to dig down 8 to 10 feet. We're looking at soil science, looking for like water. So these fees are pretty comparable to what other places are charging. I didn't want to raise them too high to put too much of a burden. And so I think these prices are fair for what we are doing currently.
Okay.
Any additional
Thank you.
questions? All right, motion on the floor is to recommend final passage. All those in favor?
Aye.
Any opposed? Okay, that motion carries. Thank you. Thank you for waiting so diligently for your turn. We're gonna leave O24, O41 on the table?
Seeing nothing.
All right, cool.
Moving on.
Which one was that one?
That's the elderly tax exemption.
For the same reasons, I think.
All right, so next up, I will make a motion to remove from the table O24-043.
Motion is to remove from the table that. All those in favor?
Aye.
And that motion carries. Sorry.
All right. So now before us, we have O24-043, updating field fees. I'll make a motion to recommend final passage.
Thank you. I believe we tabled this at the last committee because there was no one to speak to it. I see that both Alderman Govea and co-sponsored Tebow are here, as well as Warren Byers. Tyler, would you like to speak to your legislation?
Thank you, Madam Chair. So I definitely heard a lot of the questions and concerns this committee had with the legislation at the last time you guys met. My apologies for not being able to make it. But so with these fees, so I'll hit kind of the two major parts first. So the difference between having a residential and non-residential price, that was something we came up as a group, and that was more of the administrative portion of it. And when looking, we said, okay, so we could theoretically do two different prices. You have your in Nashua leagues and your out of Nashua leagues, but who is going to do that work? Who's going to go, as I called it in the meetings, who's going to go around and check the driver's licenses to see where everybody's from? It created a large amount of work on what is already a smaller department. So that's why we decided to go with more of the flat rate based off of 2-hour segments. Obviously, lighted fields, you're going to pay a little bit more than your non-lighted fields. So what I came before you today to really talk about, so page 211 of our budget from last year showed that they took in about $21,000 in field fees, and that was of 3/31/24. Under this new proposal, you'd be looking substantially more revenue coming in. We kind of had an inventory sheet that we worked off of here that showed our hours per season was right around 15,000. We were 14,971 and a half, if we want to get really technical with it. So under this new proposal, at $25 an hour, if you were to just multiply simple math, $12.5 an hour, you're looking at roughly $166,000 in new revenue that would be coming in. The way we came up with that $25 price and the prices of the lit fields was based off of surrounding communities. We were charging so little for these leagues to use our fields for so much time that these fields were getting worn down, they were getting beaten, and they're used every second of every day. These new prices don't make us the most expensive. We're still relatively the cheapest, and at the same time, we're going to be bringing in a lot more revenue. City of Concord, I have in front of me, for residential is $27 an hour, for non-residential is $42. We look at Amherst, non-residential is $45. Merrimack is about $25 an hour when we look at those field prices. So we fell right in line with that kind of $25 an hour range, where that would allow our fields to hopefully lighten up a little bit. I can't imagine all almost 15,000 hours are going to be booked immediately. I'm sure there's going to be some hesitation. There's going to be some leagues that are going to say, well, I'll go find a price better somewhere else. They won't find it. So they'll probably slowly end up coming back as well. And that will kind of allow our staff in DPW to keep these fields in better shape. They're heavily used, which is fantastic. A lot of our baseball, softball fields, and there's a lot of cricket that goes on as well, our soccer fields. So this will really just allow for better maintenance of the field with this new money coming in. And this was a kind of a long, kind of hard thought out process here, but that, I believe, answers the two major questions this committee had at the last meeting. So if there's anything else, more than happy to ask.
Alderman Tebow.
Thank you, and thank you to Alderman Govea, because he was at the last meeting where a lot of this was hammered out. I was at some of them. I just wanted to clarify, I was at the last meeting, but people didn't like what I was saying and wanted to hear from the city, so that's why Ms. Byers is here. I thought we asked for a fiscal note on the actual material, but it's again not there. So I don't know if that was missed somewhere, but Alderman Govea basically gave you what the fiscal impact would be. I mean, it's revenue coming in. I think that's a good thing. Knowing, because, coaching in some of these leagues, these fields are highly, highly, highly sought after. So I don't think that's going to go down just because we raised it. I think and again, it's a good thing, but now maybe I can get another rake at North Commons. So, I mean, that's what we're, trying to get so that we can get more revenue to try to keep these fields in better shape, so. And Ms. Byers is here if you need her to answer.
Do you want to join us in case
Just
Alderman have
clarify a point
questions?
quickly. So
Sure,
that
Alderman
the estimation I gave was based solely off of daytime rates at $25 an hour. So you could mix in, it would be a higher revenue than that based on the evening rates at $50 for that 2-hour spot. So that's kind of a low-end estimation based off kind of the math and numbers we had presented with us.
Lauren Byers, Division of Public Works, Recreation and Communication Administrator. I think I'm asleep, I have to wake back up. So that money is actually for a 2-hour block. And it's not hourly, it's for 2 hours. So it'd be 25 for non-lighted fields, 50 for lighted fields. The biggest problem that we see with this right now is we currently have, from an ordinance, back from 2018, we charge $300 for non-lighted fields for the entire season, April through October, $500 for lighted fields. So a group that only uses a field for 90 hours is paying the same $300 as a group that's using it for 455 hours.
Yeah.
It is completely inequitable. It is unfair. Groups that can't get on a single field because it's booked have to use 2 fields. Well, guess what? They get charged twice. Also unfair, and they may use the fields less than the group that's on a single field. So this going to an hourly rate like other towns, as Alderman Govea and Alderman Tebow said, would put us in line with other towns, and it would be very equitable. If you're using the field for 455 hours, and we have that, you're going to pay for the 455 hours. So this is really just bringing us in line with other towns. It's something that should have been done many years ago. I appreciate the work that Alderman Govea and Tebow put in. It was a lot of research, seeing what other towns were doing. Certainly, I have more accurate figures for you. So in the 10 to 20,000 we normally bring in, if all of these teams remained at the same level as far as field usage, we would go from, 15 to 20,000 a year to 108,000. We are having sustainability problems in our fields because of the heavy use. Also, it's hard to expand our youth rec programs where there's no space, which means now having to argue with our current leagues to take space back for our Nashua youth. These fees do not at all impact our Nashua Youth Rec Leagues, such as Cal Ripken, Little League, Nashua Youth Soccer League, and Nashua Blast Lacrosse, and our own Babe Ruth Leagues, softball and baseball. They always receive our fields for free because they're our Nashua Youth Rec Leagues. They're there designed and run by Nashua residents to serve our Nashua youth. So they will not be impacted whatsoever. It's only the outside groups, the travel teams, the adult teams that will be impacted by this. I'll be happy to answer any questions you may have had.
Alderman Lopez, then Alderman Jettie.
Yeah, so you did basically cover my question. Who are the ones who are the biggest users? Because I think it would be a concern of mine. I am definitely interested in Nashua sports. I also know that there might be some leagues that integrate regional areas of that nature and are opportunities for Nashua sports or Nashua athletes to play in multiple locations. So you mentioned a couple of travel teams. Who are the people that you would say probably get the most hours but pay the same rate as other groups?
The people who use our fields the most are actually the adult leagues.
Okay.
Not the youth leagues. So they are the bulk of our nighttime field usage during the summer months in the spring. outside of the Nashua rec leagues. The AAUs are much more minor players on our schedule.
Alderman Jettie?
Thank you. So, I'm, 100% in favor of going from 15,000 to 108,000. That seems like a good deal to me.
85.
But, having, having coached soccer in the ancient past, I remember that, we had a lot of trouble getting, practice places. And there were times when, when the soccer fields would get so beat up, we'd close them for a summer or season to allow the grass to grow back. So, there's no question that, that our fields take a beating. And, I just want to make sure that we are, this is not affecting our youth leagues. This is affecting, renters, and sounds like mostly from out of town. So are we, when you say, well, the fee we're charging is comparable to other towns, is there room there to charge more? I mean, is there enough, I don't want to, I don't want to second guess what you've been working on, and I just want to make sure that we're getting, a fair return for what, for all of the money we're investing in these fields. Are these out-of-towners paying their fair share with this new schedule?
Well, yes, so there's always room to add more money as far as, let's face it, that can always happen. However, we are trying to be fair. The adult leagues that use our field, some of the players will be Nashua residents, not all, but some. And of course, as a recreation administrator, you encourage recreation in any form, whether it's the youth or the adult or anybody in between. But I will say, just to give you an example, if they kept the same schedule, what the cost would be for some of the adult leagues that use our fields the most. And the biggest jump would be an additional $14,000 a year from a current fee of $1,100. So we are hesitant to go higher. This is a big jump. Additionally, we, as a committee, decided to hold off on implementing these fees until 2020, the season of not fiscal year 26, the spring season of 2026, giving them an entire year to understand that if you keep the same schedule you've done for the last decade, this is going to be the difference in cost, so that they can make determinations on looking for, as Alderman Gouveia said, going to other fields or cutting back on their schedule. And quite frankly, that works for us in either case, because our fields get more time to rest. We are currently, our new superintendent rests one field a year where no one can utilize it. We block it off for that reason, because it's sustainability is tough when you've got, 7 days a week your fields are in use. So something needs to change, and we think this is probably a good first step to bring us not also in line financially, but just for maintaining our many, many fields. Most towns don't have what we have here. They have one or two fields. Even Manchester and Concord, I don't think, have as many fields as we do. So we do get a lot of groups that choose to use our fields. We do a pretty good job maintaining them, and they do appreciate that. We could do a little better if we had some more time to work on them. We've had to move people off the field to mow. It's tough. So anyway, we do think this would be very helpful.
Alderman Clemmons?
Thank you. So, please correct me, or so I can understand. Is this starting this year in 2025, so the summer of 2025, or spring, summer, fall of 2025, or is it starting spring, summer, fall of 2026?
2026.
So should we amend the legislation then to say effective January 1st, 2026?
Yes.
Okay. Then I will make that amendment. So I move to amend to effective date the language of this to be January 1st, 2026.
You've heard the amendment. All those in favor?
Aye.
Any opposed? Okay, motion carries. Now, we have before us an amended legislation. Alderman Wilshire wanted to speak.
Thank you. So fields are the reason I got into the business of being an alderman. I lived across from a park. It was rough. It was overutilized. It was busy 7 days a week. But I think this legislation is fair. I think it's a good idea to do this. I mean, if we can get more money from people that, and not just get money from them, but I think when they pay more, they kind of appreciate it more, and it just, not that anybody wants to pay more, but knowing that the competition out there for fields is awful. I mean, like you said, there aren't enough fields to go around. So I think this is a good piece of legislation, and when it gets to the full board, I'll support it.
Okay. So I want to say my appreciation for Alderman McVeigh, Alderman Tebow, and Ms. Byers for doing this work. It's clear that you guys have really put some thought into this. I'm not going to die on this hill, but I do feel that the questions around non-resident versus resident were valid, and I think that, when we're maintaining them as taxpayers, allowing us to have some of a break when we'll also maybe take people who aren't in Nashua and have them consider other places. So just a thought that I want to put out there, because I think we're hearing there's overuse. We pay for them. When you go to the dump, which is Nashua, I pay $5 because I'm a resident. I don't think it's too hard to just determine whether a person is a resident.
Actually, if I could speak to that, we're looking at rosters. So there could be 20 people on a roster that we have to verify are Nashua residents.
Interesting.
So if we have, 15 AAU teams and 20 adult leagues, now you're talking serious numbers. Additionally, they could put down anything, and I wouldn't be able to verify that that was actually somebody's address. Also, our hourly rates currently that we have are rarely used. Everybody wants seasonal because they're leagues. So I would say I actually book a field for an hourly rate 3 times a year. Now, I know we're getting rid of our seasonal rates, so everybody will be hourly. But the teams that are truly Nashua residential teams get the fields for free, those youth groups. And the adult groups tend to be business groups or...
Thank you. That helps. I understand, and now how that was hard for you makes more sense because you get a roster. So thank you for clarifying that. Any other discussion? Alderman Tebow.
Yeah, just a question, thank you. I just thought about it when you said that. So these fees go with people that just like, I got a birthday party, I want to, reserve a park for a couple hours. If they're a resident of Nashua, would they still pay these fees?
They would, and they're actually currently lower than what we're charging now per hour for Nashua residents.
Okay,
So
yeah. Good.
Okay.
we
Alderman
can
Clements,
raise
did
them
you-
above what our current rates are.
Did you have something, Alderman Clements? Okay. Motion before us is to recommend final passage.
As amended.
As amended, thank you. All those in favor?
Aye.
Any opposed? That motion carries.
Thank you.
All right, public comment.
I made it through the whole meeting. Those benches are kind of hard. Now I know why you have them hard, so people won't make it through the meeting. My name is Paula Johnson. I still live here in Nashua. And I want to thank, first of all, Alderman Moran for working with me on this legislation for the seniors. I do agree with Alderman Jettie, but with the numbers, because single and married are totally different. Chances are this will not affect my husband and myself because our income will probably be higher because he's 76. He works about 50 hours a week because we cannot afford to retire. And everybody basically knows where I work. If you're in Nashua, you see me in retail, which, and I do that because when we had these lockups in the city, I went into severe panic attacks. So now when I feel being home, I feel like I'm being locked up and I can't get out anymore. So I choose to work with a disability because back when I couldn't qualify for the disability exempt, and I was disabled until 65, and then I went on regular Social Security. And many people didn't know about my disability because I hid it pretty well. I have a very bad case of fibromyalgia. Most people don't know. And so this probably won't help my husband and myself, but if I can help some other seniors and disabled in this community, it's about time that we get looked at here. Again, we are the ones who have built this city to where it's been. We have lived here, we have paid our taxes, and we never squabble very much about anything because we were taught you pay your taxes, you do what's right in life, and you don't ask for anything. That's what we were taught growing up. And that's where I am at. I come here and I say my piece because this is what I've done in this city since 2000, between being on the Board of Education twice, alderman and a state rep. I've been here serving whether I'm elected or I'm not elected because I think that when things are unfair, it needs to be corrected in this community. I think there's quite a bit that's unfair. I'm glad you're raising the fees because who takes care of all these fields? We do. As they get run down, we're asked again to replace and clean up. And I think it's about time we take a look at all the spending that's going on, which I'm going to talk about tomorrow. I should be here because I am outraged on everything. And I think this 3-minute policy, as I said, I looked things up here. 3 minutes isn't enough for us. You know, we're the ones who elect all of you. You're supposed to be representing us, and you cut us off at 3 minutes, and that really isn't right. I granted 15, 20 minutes, it's way too long. Even when I sat on both boards, I mean, people just go on about the wrong things. But 3 minutes, it really isn't fair for us to say our piece, especially this has been over a 3-hour
Time's
meeting
up, Ms. Johnson.
tonight, and I've sat here during this whole meeting listening to everybody else. Thank you very much. Have a good night.
Thank you. General discussion.
Excuse me.
Oh, sorry, didn't see you. Go for it.
Andrew Sylvia, 6 Autumn Leaf Drive. I'm also an alternate on the ZBA, and as some of you may know me, I'm also a journalist. And last year, when I became before this committee, Alderman Jetty asked me if he'd ask me rather be a journalist rather than a ZBA member, and I've tried to be both. But tonight, I felt that I'd be the ZBA member first and a journalist second, given some of the comments to my colleague. Josh Naheely is an excellent member of the ZBA during my time that I've been on the ZBA. Mayor Donchis should be applauded for renominating him. He's done a great job. We don't have a lot of applicants for the ZBA. In the year I've been on the ZBA, I think all 5 full board members have been on one meeting ever. So it's hard to get members. It's very difficult, and there's going to be more archery lane things going on. So if we don't help people understand that the volunteers are welcome and supported, it's going to be hard to get them. And since the matter of archery lane has gone through the legal process, I just wanted to share my thoughts on what happened in that situation. I personally believe that groups such as that one, things that need to come before the board, sober living places, need to be supported, but I don't believe that was an appropriate situation for a variance, and that's why I spoke against, sort of in support of bringing the matter to the appeal. Some of the facts that I heard, in addition to Corporation Council, which was important in my decision, was that there would be up to 30 people in what was a 2,500 square foot house, which I've seen many hearings on similar situations. That seems like a very large number of people for such a facility. All those people would have been allowed to have cars in a single-family residential neighborhood, which also is unusual compared to other applications I've seen. And it would have been difficult for neighbors to park their cars. We also had some concerns about mold. And also, the applicant came in before talking with the community and talking with the neighbors and just went forward. I believe they should have come to the neighbors in the community first and tried to work together with the community. In that sense, I believe that the 5 criteria under RSA 674-33 were not met. My personal opinions are not important. I try to follow state law and city ordinance and all the decisions I make on the board, and I feel that I did that, and I can't speak for anyone else on the board, but I feel that we did a good job on that. I don't think we made a mistake. Thank you.
Thank you. Any additional public comment? I can't see behind the lectern. Okay, general discussion. Any remarks by Alderman? Do I have a motion?
Motion to adjourn.
Motion to adjourn. All those in favor?
Aye.
Motion carries, and we are adjourned at, I don't see the time because you turned, thank you, 10:35.